have to do a lot of thinking about it. My first point is that we have to make a really plan a national campaign and to really implement the 73rd and 74th Constitution Amendment. Why Kerala is today at this position? Because of that people's plan campaign the Kerala provided. It conscientized the entire population. That conscientization is not there in this country. And we have to take all the states and the state leaders, the civil society, everybody has to come together for that. And that is, in other words, the investing in people. We are not today investing in people. Investing in people, we may say only education. Yes, education, and it has several other aspects of it. And if we create that investing in people, then that creates social capital. And when we have that social capital, we can really fight any calamity and save the people. The poor, the needy, the weak, everybody will be in the center of our concern. So let us have a slogan, our panchayats, our future. Hamara panchayats, hamara bhavish. If we can create that, then the other governments can be built on that base foundation. Without a foundation, how can you create an edifice? So let us all champion this, campaign for it under the leadership of the pioneers in this, and all the intellectuals and thinkers who have been participating in it was very inspiring indeed. And let us not give up. Let us go forward. Thank you.
Thank you. Matthew, the chairperson and the panelist, it was indeed, as our minister rightly said, it was a very enlightening session. Of course, the West and North move a long way forward, but a big beginning has been made. We're happy about it. Thank you very much. Now we are actually late by a few minutes. I think we are going to thank the chairperson and the panelists, and the next chairperson and panelist is going to come. You may please mute your video and audio. Thank you very much. May I invite Dr. W. R. Reddy, Director General of National Institute of Rural Development, to chair the next session. And I understand that other panelists, the panelists of the session are from Tamil Nadu, Professor Palanithurai, Karnataka, Srimati Uma Maheshwaran IAS, from Telangana, Sri Sandeep Kumar Sultania IAS, then Andhra Pradesh, instead of Sri Gopal Krishna Dwivedi, we will have whether Dr. Reddy is around. Hello. Hello.
Yes, sir.
Yeah. This is for the kind attention of the chairperson, Dr. W.R. Reddy. We will be having Dr. S.S. Meenakshi Sundaram in this session as the last speaker. And the last speaker, the scheduled last speaker is not able to join us now. We have Dr. Meenakshi Sundaram. Okay. Over to you, Dr. Reddy. Thank you very much and welcome you once again, all of you.
Hello. Good evening, Reddy. After such a long time.
Dr. Reddy, are you able to hear us? Hello. Hello.
Sandeep Kumar.
Hello.
Sir, good afternoon, sir. Sir, DJ and ID, sir.
This is Dr. Parnidurai.
Hello.
Whether Dr. Reddy, W. Reddy? Hello.
Hello.
Hello, Meenakshi Sundaram. Voices from Link. Hi. Good evening.
Hello.
Yes, can we start the session?
Yeah, we are. Hello.
Hello.
We are trying to see how many of the panelists are around. How many of the panelists have joined us? We are trying to check. Just 1 second. Just 1 second.
There is some problem with the research taking it.
Hello. Hello.
See, I think there is some connection problem with.
Can you hear me now? Can you hear me now?
Sir, we can hear you. Ready, sir? We can hear you.
Yeah, can you hear me now, everybody?
Sir, ready, sir? We can hear you. You are audible.
Okay.
There is one
Okay.
problem with your video. That's
Good,
okay.
good
Go
afternoon.
ahead with your video.
Hello.
Good afternoon.
Hello, Dr. Reddy. We have a small announcement for you, for your kind information. Dr. Meenakshi Sundaram will be speaking in this session. Kindly note that. Okay? Dr.
Okay.
Dr. Reddy?
Okay.
Yeah. Dr. Meenakshi Sundaram
Yes.
was supposed to speak in the opening session, inaugural session, and he will be speaking, he will be joining us today this session. And we will get some time because the last speaker is not here. We'll get some. Yeah, you won't be under any.
Okay, thank you.
Take care.
Thank you.
Welcome to you and all of you. I'd like to give to our minister.
Okay.
No, I have no opening remark. I'm here to listen to you. Fine. So, hello to everybody. As I told in the morning, we are meeting many people who are all together right from the early 1990s when the 73rd, 74th constitutional amendment was passed. And this journey so far, lasting more than a quarter century, have been mixed. Okay, you have some exemplary experiences in India. It shows the potential, great potential of the democratic decentralization. While at the country at large, we have been lagging behind. But I think the pandemic provides an opportunity to bring the local governments into the center stage of national debate, because there is no way other than fighting COVID at the local. So that can be done by really local governments, and that is the significance of our sessions. Thank you.
Over to you, Dr. Reddy.
Thank you, Dr. Thomas Isaac, and thank you, Dr. Thomas Isaac, and of course the panelists. Myself, Dr. W.R. Reddy, Director General, NIRDPR. We have 4 panelists. If I'm right, I think the Principal Secretary from Andhra Pradesh is not able to join. We have Mr. Meenakshi Sundaram, Dr. Palnidurai, and we have Srimati Uma Mahadevan, the Principal Secretary, RD, and of course Mr. Sandeep from Telangana, and of course my friend Professor Rajashekhar is there to sum up the reflections on southern states. First of all, let me congratulate Kila and GIFT for organizing this wonderful webinar at the right time. And I really am very happy to see the GIFT auditorium, which of course I never had the opportunity of using it, though we have got the inauguration done during my time when I was the Secretary Taxes. So I'll not. Yeah.
Kila sir. Hello.
So
Hey,
in fact, I request everybody to mute their microphones when somebody else is speaking, please. As NIRDPR, of course, right from the beginning of this pandemic situation, we had been taking up a large number of IEC activities, of course, through AV material. In fact, on 1st April, 1st to 3rd April, we have released one AV material which captures the complete approach for the Gram Panchayats. It is available on the YouTube. On 3rd April, we have released, and we try to reach to most of the panchayats on how to manage the pandemic, how to manage the reverse migrants. They are going to come back to the Gram Panchayats, and so on and so forth. A large number of efforts have been made. I think the panchayats ought to have been the natural leadership choice to tackle this pandemic. There was no second thought. There cannot be any second thought. But whether it has happened, whether the panchayats have wound it up, whether the middle level bureaucracy and top level bureaucracy could enable such natural choice, of course, is debatable and varies from state to state. I feel the COVID crisis, every bad crisis gives an opportunity, a large number of bright opportunities. I think this crisis has given an opportunity to retrieve, to demonstrate, and to show to the world that the local governments are capable of, are better than other agencies, and capture that space and make that imprint and capture that space imprint of their relevance. So whatever the southern states, in fact, I quickly compiled some data. If I summarize the data, the southern 5 states accounts to about 18% of the reported positive cases. This is the today's data I have captured. 18%, and of course, Tamil Nadu is at the worst situation with 65% of the southern states contribution. And of course, in terms of recovery percentage, as against the national average of 35%, we in the southern states stand at about 34%. And of course, recovery is fantastic in Kerala with 84% recovery of the infected positive cases, followed by, of course, Telangana and Andhra Pradesh and so on and so forth. In terms of mortality, as against, of course, the 3.2% national average, the southern 5 states stand at 1.17%, and of course, with the highest percentage of 6+ in Andhra Pradesh and so on and so forth. Of course, these numbers may not mean anything, but the numbers will show way forward. And I think the problem has just begun. The problem is not yet over. And learning from the successful states, successful experiences can be of great help to other states. I think what state governments and center has given to the local governments as in terms of role clarity or delegation or funds, resources, looking from that angle is one approach. In fact, that I think a lot of people have commented that, and then pros and cons, strengths and weaknesses. I'm not getting into that. But I am looking at another approach, that is, can we as a local government leadership show the way and prove that local governments are the only way forward in such disaster situation, in such pandemic situation? Are we prepared? Are our leadership is ready for such challenge? I think that is what I am really looking at, and I expect the panelists to make mention on these aspects. So, friends, I'll open the discussion to the panelists, and since we have 4 panelists, I request each panelist to make their point for about 10 minutes, and then followed by Professor Rajshekhar. And then if time is available, I'll get back to other again to the panelists, and I think we can take some questions also. So with these words, I request Mr. Meenakshi Sundaram sir to make his observations. Over to you, sir, Meenakshi Sundaram.
Thank you. Am I audible? Can I start?
Please start.
Yeah. And thank you very much for inviting me to give my comments on this. I wanted to start with the constitutional position first. See, under the Indian Constitution, the 11th schedule clearly says health, including primary health centers, dispensaries, hospitals, they are all the responsibilities of the Panchayat Raj institutions. Subsequently, in the Disaster Management Act, when there is a disaster, we have created authorities at the central level, state level, and district level, which are somewhere parallel to the Panchayat Raj institutions. But the understanding is, whenever the problem is local, the panchayats will act straight away, like in the case of tsunami or the floods, which were localized. There the panchayats will act, and when they feel that they need some more help, they were looking at the center or the state, which provided the funds and also sometimes the capacities. But when the problem is a pandemic, it is natural that the central government starts with the interest, but they should not forget the local governments. What happens is the role of the central government, state government, and the Gram Panchayat should be clearly defined. Now, the case of Kerala, though the decisions were taken largely at the state level as to how to handle this, the responsibility of handling was settled with the Panchayat Raj institutions in consultation with them. I understand that the local primary health centers were entirely managed by the panchayats, and they were able to ensure that the local centers are able to act better. Now, this is the practical side of how to handle this. I'm sure from the 3 states which are now going to follow me, probably they will explain what they have done. But in the time available to me, I only want to say what are the things which panchayats can do. The first point is we do not know how long this COVID-19 is going to continue. We are not certain whether the problem will be solved in a few months or it will take few years. Now, we have been told the only method is prevention, and in prevention there are two things which are mentioned. One is social distancing, and the second is hand washing and maintaining a good sanitation. For both, we need the cooperation of the local people. The first requires some kind of change, the social distancing. Here again, the people have to be told what is meant by social distancing and how that can be achieved. Panchayats are the best institutions who can do that. Second is the water supply and sanitation. Now, panchayats to get into the water supply and sanitation areas. Now, though under the constitution, water supply and sanitation is given to the panchayats, many a times it is now done by the state departments. I would therefore request that we should take up activities like desilting tanks, rainwater harvesting, improving the availability of water, better distribution. These are areas which the panchayats can legitimately do in the coming future. The second point is, in the period of lockdown, what really happened? We did not have any problem in the cities to get the meat, but we had a huge problem for getting the vegetables and fruits. We had situation in several parts of the country where fruits and vegetables were available at the village level. They could not sell it, they threw it, whereas in the cities, we were wanting to buy vegetables and fruits which is not available. Even today, I am told in Salem district there is plenty of mangoes, good quality, but they do not know how to sell that. Therefore, it is still remaining in the trees. Now, that being the case, we need to find how to strengthen the supply. This gives an opportunity for the panchayats to go in for more and more of farmers producing organizations. We will form them into cooperatives like what we have done in the case of dairy. Like our getting the milk supply without any problem, we should be able to get the supply of fruits and vegetables even during the pandemic days. So the second area where I expect the panchayats to take interest is to organize people's institutions, farmers, producers, cooperatives or organizations which can provide better marketing and a supply chain. I will explain only one more problem and then stop with that. That is relating to the so-called reverse migration. Whether it is the appropriate word or not, I will not get into that discussion. Whether we like it or not, large number of people have now come back from urban India to the rural India. Now, this provides, according to me, an opportunity. When we created the Gram Sabha,
Excuse me, sir, for interrupting you, Dr. Meenakshi Sundaram. I'm sorry for interrupting you. Please speak to the mic because of you. Please speak to the mic. We are getting a lot of complaints from the YouTube. You are not clearly audible. Please bear with us. Sorry for interrupting you. Please speak to the mic. Thank you very much.
Okay, thank you. The one other point I want to mention is that in the case of reverse migration, whether we like the word or not, the panchayats have an opportunity to act. When they entered the Gram Sabhas in the 1983 Act of Karnataka, one responsibility given to the Gram Sabha that they will identify who are all the people, able-bodied young men in the village, what are their skills and how they can be employed. Should it be in the wage employment program or should it be in the self-employment program? Now perhaps we have to do that. We have to convene the Gram Sabhas, keeping the social distancing in mind. Of course, it is not that difficult in the village. The coronavirus had gone deep into the urban areas, but not that much into the village. Therefore, we can have a Gram Sabha in which we can identify who are all the people who have come from urban areas to the rural areas and who belong to that village, what are their skills and how do we make use of that. We can also identify the raw material available in that area and ensure that with the raw material availability and the skills which have now become available, can we start some kind of a micro, small or medium enterprise, the MSME in a village panchayat? I believe it is possible to establish 2 to 3 MSMEs in each block if not in each Gram Panchayat, and ensure that the people who have now come back to the village are properly utilized. Now, these are the areas where, other than Kerala, in the remaining states, we need to concentrate on. In my view, if we form farmers, producers, cooperative societies, if we concentrate on water supply, sanitation, rainwater harvesting, desilting of tanks, etc., and also have one MSME per block or per gram panchayat, depending upon the size of the place, keeping in view the skills available and the raw material available, that will ensure that we deal with the aftereffects of COVID-19 properly. I am sure most of the states are taking their own actions. It is necessary, as has been discussed so far in this group, that how to involve the panchayat should take a priority. Ultimately, I believe with my experience in government, what I have learned is, unless we make a program, people's program, it will never succeed. If it remains, success are very limited. If we involve people and there is a people's participation in the program, it can succeed. The only method of ensuring people's participation is through the Panchayat Raj institutions. And that is what we need to concentrate. I think I will stop here. If there is any need, I will come back in the end. Thank you very much.
Thank you very much, sir, for your short and brief and very important message. Thank you very much. May I now request Dr. Panidurai to make his observations, please.
Hello. Hello. Am I audible?
Yes, yes.
Hello.
Yes, please go on. You are audible.
Okay. Mr. Chairman, let me at the outset express my deep sense of gratitude to the organizers for having given me the opportunity to interact in this webinar on a very important subject which is dear to my heart. Since the chair has given a framework of what is expected from this panel, I'll stick to it. First, I will give an overall picture about what is going on in Tamil Nadu, but I'm not representing the government. That I closely work with the government, but I'm not representing the government in this webinar. That you have to note it. So, what is the reality today in Tamil Nadu? We have local bodies. We don't have an urban local body because election has not been conducted. We have a rural local body. Elected leaders are in position. Number one. Number two, the state government is very serious, very meticulous, giving, series of instruction in the form of a booklet to all Gram Panchayats. What are the steps to be taken by the Gram Panchayat in this context? The second one is, what are the materials needed to perform the task by the Gram Panchayat that is circulated through the block Panchayat and ensure that it should reach in time to the village Panchayat. This is the second one. The third one is, you have enormous information, but whether those informations are correct information and how to reach the people. Now, the pandemic situation is very critical in the rural areas and everybody is panicky. So how to give, confidence to the people who can give? It is not the officer, it is only the leader who can give. But when we come to the leadership, because our chairperson has rightly pointed out, they are elected fresh, they have undergone one-day training, and they got a booklet also about how to manage your panchayat and other things. Now they have sent this, booklet about how to manage, COVID-19. This is also there. So in that context, we have to look at generosity is very abundant in Tamil Nadu. Food is not a problem. Supply of food is, supply of food material is not a problem. Vegetable is not a problem. Everywhere you have enough, material, but they are to be distributed. But even in the coronavirus, spread is more in urban areas rather than in the rural areas. But wherever we find strong leaders, they have a passion, they have a commitment, they have a capacity, and they have taken responsibility by using the provisions available in the Act as well as using the provisions available in a GO passed during a tsunami period. And they are taking care of the people and they supply material and they ensure safety and they provide all necessary things to the villages and they are doing their best. But this is not the case in all Gram Panchayats. But the state government is taking an earnest effort. If the Panchayat president is weak, not in a position to do it, so what they are doing, their officials are there to support it. They are doing such a kind of thing. This is the position. And another very important thing is, I mean, every day, I mean, they are giving a communication. But carefully, we have to understand, people mobilization is more. People mobilization is more important in this context. And giving information to the people is more important. That we call it as, conscientization of the people. Conscientizing the people, conscientizing the leaders, conscientizing the officials on the new situation, how to prepare them for a new life. So what to do? But majority of the Panchayat presidents are demanding a new GP-DP has to be prepared in a new context because they got the instruction from the government that 15th Finance Commission, allocation and subsequent changes also in the allocation. So in that context, many of the leaders are posing, a demand that a new perspective plan has to be prepared. I think they are going to prepare. This is one aspect of the situation managed by the Gram Panchayat in Tamil Nadu. The substantive issue is, whether the local bodies are empowered. That is the most important thing. If you look at the powers given to the Gram Sabha, powers given to the Gram Panchayat, powers given to the whole of the Panchayat, in my opinion, if I am there, this is more than enough. I can do wonders in that. But to that level, capacity building has to be conducted and enhance their capacity. That is why I'm saying that it is a leadership quality. Then there is another political culture that is more important. How the government is treating the people. Most of the occasions, because we always quote Kerala. Kerala treat the people as citizens. They have also responsibility. So when a responsibility is given, they have to act and they have to participate in the whole of the thing. But whereas in Tamil Nadu, we have a culture and that culture is beneficiary culture. Most of the occasions, our discourse is only on benefits, not about the responsibilities, not about their participation, not about the responsibilities of the citizens. So in that context, our discourse, unless our discourse is changed from the beneficiary culture to participant culture, following the model of Kerala or any other state, it is very difficult. But I'm reminding one thing. In 1965, there was a lecture by JP in All India Panchayat Parishad Convention. He stated very clearly that, unless there is a movement from below demanding powers and deciding things, any number of acts, in this country cannot change the situation. Such a way, he made a presentation as a chairperson address in 1965 in Bangalore itself, in All India Panchayat Parishad annual conference. So what I feel is that right now, what we have to discuss is how to change the discourse, especially states like this. But states are concerned with the people, no doubt about it. They are giving large number of programs. They are giving large number of, schemes and other things. But the question is, are we going to treat them as citizens, responsible citizens, and they participate? Unless otherwise, we convert the local body institutions as a mere spending institutions. If you give money, from central government or state government, they will spend. If you stop money, they won't act. Otherwise, it is very, very difficult. So the whole of the discourse has to be changed. Then one more aspect, just I want to discuss here in this forum, because all the 27 years, I have been listening to all our friends, because we are all fundamentalists of Panchayat Raj. So we believe Panchayat. And there are others, fundamentalists, market fundamentalists, and they also argue that, I mean, market is more effective than your local body. In such a way, they are arguing. So in that context, one panchayat president after the election, he telephoned to me, he asked me a question. I mean, all the time you are demanding power, demanding power. You are saying that it is the constitution. Why they are giving? Is it not fair on our part to claim our, I mean, actually powers through the Supreme Court, taking it to the constitutional bench and get clarity from the constitutional bench as the basic framework of the constitution? They got it. I mean, in the same way, and we have to go to that level and get clarity. Otherwise, all the times, I mean, activity mapping, give more powers, give more powers. And always I used to think that, I mean, you take the power, you act on it, then it will speak. So otherwise, it is very difficult. So in that context, as I understand from the field in Tamil Nadu, there are vibrant panchayats taking responsibility, delivering goods, and taking personal risk also. Even before getting the direction from the government, they have started distributing Kabasura Kudineer, all these Siddha medicines to all the households, and taking the counts of the single-headed families who are all suffering, I mean, who are all in need of food and other things, and they are locating and they are supplying, and they issue voluntary, I mean, the volunteers identity card also. They do all kinds of things. Wherever we find leaders, those who have got the capacity to manage the institution. Of course, there are many panchayats, they are not in a position to understand, they are new, but even there, and there the officials are supporting because they have to report it to their bosses. So they are also doing it. In my opinion, I mean, the service delivery is fine, but from the perspective of empowering panchayat, empowering the people, and that depends on the political culture of a state. In our state, what we believe strongly is, I mean, our bureaucracy is very strong. It will deliver effectively. That is also true. But substantially, we are arguing that unless you empower the people and the local body institutions, even another 100 years, we will continue in the same position. So in that context, what is need is building the capacity of our leaders. I mean, who is a leader? If he's a leader, he will take power. I mean, if he's not a leader, he will demand power. So in such a way, a leadership training is more important for our local body leaders, number one, and changing the narrative of the whole local body from beneficiary culture to, I mean, participant culture or citizenship culture. And citizenship creation is more important. When we talk about Gram Sabha, I mean, it is a place for discourse, deliberation, arguments, debates. It is not, grievance redressal session. So in that context, what I believe is, I mean, to strengthen the local body, primarily building the capacity of the leaders. And because in Tamil Nadu, we have more than 400 schemes are there to develop people. If they are able to make use of all those things, it will happen. And another thing, GPDP is the demand of many of the Gram Panchayat presidents in the new context after seeing the direction from the central government, Ministry of Panchayat Raj, after giving the allocation. So these are the things we need to strengthen local body and to manage the community and to, guide the community and to mobilize the people for a new kind of life which we are going to see in the months to come, in the years to come. Thank you.
Thank you, Dr. Palanidurai, for the points you have made. May now request the of Karnataka, Srimati Uma Mahadevan. Over to you, ma'am.
Good afternoon, everybody. Am I audible?
Yes.
You hear me? Yes. Okay. Greetings to everyone. And at the outset, I'd like to say how much I greatly appreciate this initiative to have this webinar. My special thanks to the respective Finance Minister of Kerala, the Honorable Dr. Thomas Isaac. My congratulations to Killa and to GIFT for putting this webinar together at a very, very opportune and appropriate time. I do hope also that this experience sharing, which has already been a great learning experience for me, I've been making detailed notes, I hope this experience sharing will be only the first of many more regular such sessions. It would be wonderful every 3 or 4 months if we could get together and have a quick recce of what all we've been doing, because that can be very strengthening, and also I think it's also very energizing for all of us working in decentralization. It's very energizing and hopeful for all of us to hear from each other, because this is an area where solidarity is equally important. My presentation is very briefly going to be about how the Gram Panchayats, the local governments of Karnataka, have used certain enabling guidelines issued by us during the period of the COVID-19 pandemic, but use these enabling guidelines to rise to the occasion and really demonstrate the capacity as full-fledged local governments. Just to give you the context, what we did was in the month of March itself, very quickly, we issued a set of circulars setting up what are called Gram Panchayat task forces. These task forces consist of basically a group of elected members, including the Gram Panchayat president and the vice president. The president of the Panchayat chairs the task force. The vice president is the vice president of the task force. Select members, one at least from each village, and then select staff, the Panchayat secretary, the PDO, Panchayat Development Officer, other staff, as well as frontline staff of other departments, such as the ASHA worker, the Anganwadi worker, the auxiliary nurse and midwife, the police constable or the sub-inspector, the village accountant, the revenue department staff, as well as the village rehabilitation worker who works on disabilities, and the bank manager for financial inclusion. What we did was we issued certain guidelines giving them 4 basic roles and responsibilities. One was the most immediate one being dissemination of information, because at this moment we were very worried about, because of the information asymmetry, especially in rural areas, we wanted to fill that vacuum with science-based information so that that would be reassuring and also give a structured context to all the work that would happen. So information dissemination about the virus, about physical distancing, about important precautions, so that while we were talking about the pandemic, we were also saying these are the ways in which people can protect themselves. The second responsibility was about lockdown. During the lockdown, maintenance of essential supplies, especially to the vulnerable, the pregnant, the elderly, the critically ill, the disabled. The third was regular care activities, such as the delivery of Anganwadi rations to the pregnant women, to the children, doorstep delivery, as well as the midday meal rations to the children, as well as routine medical needs, immunization program, and so on. The fourth was safety. Important aspects of safety that would need to be taken, both for the frontline workers and the waste management staff, such as provision of masks, soap, sanitizer, hand washing stations, training in proper disposal of the masks, and so on. These guidelines were both granular but also enabling. They were not meant to be exhaustive, because we wanted the Panchayat to devise its own plans and see how they would take it forward. We gave training to the Panchayats. Our commissioners and directors quickly put together, as well as directors, quickly put together an excellent training program, which was over the space of just a few days. It conducted over YouTube Live, along with the training committee at the state level and the health department at the state level. It was a focused, interactive training delivered directly over YouTube to the Gram Panchayats, and we have a Telegram group which is active through the day, where all 6,000 Panchayats of Karnataka are active. And so on the Telegram group itself, we got photographs as well as reports about the participation. We also enabled the Panchayats to use 14 Finance Commission grants, as well as their own sources of revenue for carrying out these activities. And we reminded Panchayats about their action under about their responsibilities under Section 58 of the Panchayat Raj Act, which is, I think, the crucial section which really tells local governments how to be local governments. Because Section 58, inter alia, says that they should meet the needs of the people in the Panchayat. And we extended this to point out that they should also create an environment that is safe and congenial. All this is in the Panchayat Raj Act, in the functions of the Panchayats. And, quote, protect the rights and interests of the disenfranchised and the vulnerable. All this is in the Panchayat Raj Act, but we issued a circular, separate circular, reminding them of this and asking them to take up all actions that were required. Further, recently, once the interstate movement of migrants has started, we asked them to take up institutional quarantine as well of the persons coming in from outside. A training was also given for that. Now, this being the context, what we discovered was something well beyond our expectations. We found that the provision of structure in terms of the guidelines, the provision of training and science-based communication was only an enabling support which they needed to rise to the occasion. Because what Gram Panchayats have done since then is they have set off on house to house, they have met the needs of their people, they have checked on the vulnerable, they have innovative solutions. Just to give you 3 examples, in one panchayat, we found that during the lockdown, they had published public notices giving the details of volunteers who would be available, nobody else to be contacted for essential supplies, nobody else to be moving out. They had also provided at their own level an escalation matrix. Now, the escalation matrix is some jargon that we use from management side. But here was a panchayat, without using the words, they knew exactly what they had to do. Similarly, in another panchayat where there was in Nanjangud, where there was seal down and a large cluster of positive cases, since they needed urgently to make arrangements for medical treatment of those in critical need, such as pregnant women, they identified 2 vehicles, private vehicles of the panchayats to function as private ambulances for those who did not need special ambulance treatment, but for example, a pregnant woman who needed to be taken to the hospital urgently. And 200 to 300 people have been availed of this facility, which was just an innovative local solution which was found. A third example is of another panchayat where, due to supply chain disruptions, farmer to table vegetable distribution was carried out by the panchayat by connecting the farmer, the donors, the panchayat itself, and providing vegetable kits to all its people. In another panchayat, banking correspondents were invited. They were given space at the, and this has happened in hundreds of panchayats. They have been given regular space and time and the use of the local internet in the panchayat, and people have been able to use physical distancing and masks in order to withdraw funds and use their banking transactions. Delivery of free milk, delivery of pure water, delivery of ration kits. I could go on, but these are examples. Additionally, panchayats have reached out to self-help groups as well as to trade tailors who've had difficulties for provision of masks, procurement of masks, fabric, masks as per specifications. Mahatma Gandhi Narega. We have, my Commissioner of Rural Development tells us that we have issued 1.5 lakh job cards just from April 1st, again through the intervention of the panchayats. We have talked, again, Professor Pallavi Durai and Mr. Meenakshi Sir spoke about 11th schedule and funds, functions and functionaries. We're in the 27th year since 1993. We last year issued a government order asking panchayats to conduct a flagship review, which is conducted at the Chief Minister's level, Chief Secretary's level, district level and taluk level. We, for the first time, asked the panchayats to just go ahead and conduct this review. It's called the Karnataka Development Program, KDP review. And many panchayats, around 4,000 of our 6,000 panchayats had already started conducting these reviews for interdepartmental convergence. But it's my submission that the panchayat task forces are actually interdepartmental convergence in action at the front lines. I also have a hypothesis that what could have been a moment of great social anxiety and possible unrest and even stigmatization of migrants or returning persons has been prevented due to the timely action of panchayats in providing science-based communication. I want to mention one particular resolution which many panchayats have passed, which is that no person shall be hungry during this period in our panchayat. I find that extraordinarily moving and extraordinarily, I think it's quite remarkable that panchayats have taken this decision and passed such resolutions. It's my submission that COVID-19 has been a moment when Gram Panchayats have risen to the occasion, but they have shown their capacity. They have shown that they deserve to be trusted well beyond COVID-19. it's also, they are not only first responders, but they are the carers, their provisions of care for the life cycle at birth, before birth for the pregnant mothers, before birth, as well as after birth for the entire life cycle, even for the elderly, the vulnerable. The panchayats are the caretakers. My final point is that we have always looked at technology as possibly the it's the buzzword for delivering welfare and weeding out those beneficiaries and all those things. It's my submission that technology is neither the only way nor even the best way to deliver welfare, because technology is a centralizing force. Although it does bring certain efficiencies, it's my submission that panchayats have shown that full-fledged local governments can provide development-oriented approaches which are inclusive, welfare-oriented, people-friendly, if we only trust them to do so. Thank you so much for this opportunity.
Thank you, ma'am. Thank you very much. Trust is the important thing, I think, which is coming out based on your experience. Thank you very much. We now request Mr. Sandeep from Telangana to make observations. Mr. Sandeep.
Sir, good evening, sir. I'm Narendranath, Joint Director from Telangana SID, sir. Sir, actually, sir has gone to a minister for an urgent work, sir. He wanted to just read to inform me, sir. Please, sir. Thanks, sir. Sir, sir will get back to you offline, sir. Subsequently.
Hello.
Yes. Yeah. Are you making?
No, sir. Sir will get back to you offline, sir.
Pardon?
Sir will get back to you offline, sir. Later, subsequently.
Okay. Thank you.
Thank you, sir. Thank you.
Of course, we have been seeing by being in Hyderabad. I think Telangana had been doing good work, but of course, more need to be done, which we'll come back later. Is there anybody representing Andhra Pradesh? Andhra Pradesh? Okay. May now request Professor Rajshekhar to speak on the reflections of the southern state performance and then approach in handling this COVID-19 pandemic. Professor Rajshekhar.
Very much. Am I audible to you?
Yes, please go on.
Yes, thank you very much. And at the outset, let me thank the organizers, in particular the Kerala government and Professor Thomas Isaac and my good friend Joseph and Joy and others. And I have listened to all the presentations, and then I just around the time that COVID has struck, or COVID pandemic has started, we have also started to collect some information at the grassroots level. And we have collected information from about 30 gram panchayats over telephone during April and then the first week of May. And then this information was collected both from gram panchayats as well as households. And then I will be reflecting a little bit about the data that is just coming from the field. I will basically make 5 points, and then the first point is that system is in place. At least I can speak of Karnataka, that there is a system, and then as Mrs. Uma Mahadevan has mentioned, there is now some guidelines have been issued, and there are task forces, and then many people are the Gram Panchayat presidents and then Gram Panchayat officials. They do understand the gravity of the situation, and then they have been undertaking a number of activities at the grassroots level to, in a way, undertake the activities that are required. As a success, I can just mention that we have collected information from 60 villages, and wherein Professor Thomas Isaac was asking about the delivery, some information on the delivery, and then 97% of eligible households have obtained rations, especially rice. It's a different matter that they have not received the pulses and various other things, but that is something to do with supply bottleneck and nothing to do with Gram Panchayat. And I also would like to add what Principal Secretary of Karnataka Government, RDP of Karnataka Government was telling. And there is also innovation like WhatsApp group. And some of the Gram Panchayats have started WhatsApp group, and then they have as many as 8,000 subscribers in their group, and with which they have been providing continuously information on COVID pandemic and then the kind of precautions that they have to take, social distancing and various other things. And this is quite contrast to the point that Professor Palanidurai was making, that concentration. So there seems to be some difference that in Tamil Nadu there is a need for concentration, whereas in Karnataka, because panchayats have been empowered through these guidelines, so there is a concentration. The second point that I would like to make is that Dr. Meenakshi Sundaram emphasized about social distance. And this is something which is done very well in Karnataka. And then when we collected the information, we found out that the Gram Panchayats have issued some kind of guidelines and even put up posters near the places where social distancing may be compromised, such as water collection points, public distribution system, and so on and so forth. And then signs were already mentioned by Mrs. Uma Mahadevan. That is, in addition to that, they have also marked the places. That is the way we see in Bangalore and other places. And then some kind of social distance was also maintained. But one of the things that we need to now moving ahead, and how will the social distance be followed when Gram Panchayats take up MGNREGS works in the future, or when agricultural operations begin. So what will happen to social distance, and what kind of measures have to be followed? This is something which needs to be thought about. The other thing is that Dr. Meenakshi Sundaram has mentioned about water and sanitation, drinking water and sanitation. And here, what we could gather from Gram Panchayats, 30 randomly selected Gram Panchayats in Karnataka, is that the Gram Panchayats have been ensuring that the water is being distributed. And then one of the innovative cases is that Karnataka there are these frequent power fluctuations. One of the Gram Panchayats has written to Karnataka Electricity Board that because of frequent electricity fluctuations, and then people suddenly rush to water collection point whenever there is a power, and then water is released. So they have requested the government to ensure regular supply of power so that water is regularly distributed. So the need for people coming together and then social distance being compromised is something which can be avoided. So these are some of the, because of the guidelines that have been issued by the Karnataka government, the panchayats have been able to rise up to the occasion, and then they have also solutions. And but at the same time, when it comes to sanitation, and then we see that the performance is somewhat varied. And in coastal Karnataka, the spreading of basically application of sanitizers or spraying of medicines and all these things have been very well done. But if you go to northern Karnataka region, and this is something which is not very well done. The fourth point that I want to make is that responses by TP and reality. And Mrs. Uma Mahadevan mentioned about the guidelines and that they have been issued. And then when we asked the questions whether some of the issues that have been mentioned in the guidelines, whether they have been followed or not, almost 100% of the Gram Panchayats have stated that yes, they have followed. But reality is somewhat different when it comes to this one. So, for example, you take delivery of social services. Then the amount has been received only by 27 or 21% of the total households. And then the kind of the cash benefit that is supposed to be given to farmers has been received by 40%, not all the eligible the farmers. Likewise, even the 2 months pension in advance has been received by about 1/3 of total eligible beneficiaries. So there are some gaps between what is supposed to be done, what is actually done. So the other thing is that so it is here that as Mrs. Uma Mahadevan has mentioned, there is a regular need. There is a need for regular webinars, and then it is here that we see the problems with regard to empowering of Gram Panchayats. So there are a few problems relating to administrative decentralization and fiscal decentralization. And then when we ask about Gram Panchayats whether they have initiated any MGNREGS activities, and the response is that we have prepared prepared the job, the list of job card holders, and then action plans have been prepared, and so on and so forth. But what exactly has happened is that people are not coming forward. That's what the response that Gram Panchayats provided. And then there is also things relating to action plan being prepared, and then they have to be accepted and then implemented. And the other aspect is that ASHA worker inquiring about the health status of households or the health status of elderly. And there is a considerable variation across the Gram Panchayats and across the villages. In some cases, in some of the villages, 100% of the households told that yes, ASHA worker has visited them. But in other villages, 10%, 5% of them have stated. So there are some variations. So it is here that there is a need for regular, meetings or webinars of this kind, or regular follow-up what exactly is happening at the ground level. The last point that I would like to make is about reverse migration. I feel that then we have also asked a question about the migrants. How many migrants have come back and all those things. And then from the total households that we have covered, the total number is about 450. And the migrants have half of the migrants have come back, and half of the migrants continue to stay where they are. But the important thing that we have to remember is that 77% of the migrants would like to go back, and they are not going to stay back in the villages. So, which means that Gram Panchayats need not really do anything about the 77% of the migrants. This could be very much a particular problem of a particular case relating to Karnataka. Maybe the situation is different in other states, but only 77% of the, as many as 77% of migrants would like to go back, and they will not be staying in the villages. Who are the remaining 23% of the migrants? These are migrants who have gone to Kerala, or who have gone to Pune and Hyderabad and some of these places to work in urban informal sector. And there the people, they are really shocked, and they would like to stay back in the villages. And for them, I think what is required is some of the activities have to be introduced, including something like MGNREGS. But my own feeling is that reverse migration is not really a major problem that the Gram Panchayats will have to be worried, at least in the case of Karnataka. So this is what I want to say, and then thank you very much. Over to you, Dr. Reddy.
Thank you, Professor Rajshekhar. since we have, I think, another 4 minutes time, may I request Mr. Meenakshi Sundaram to make Meenakshi Sundaram and Palnidurai and Uma to make one point if they have left out, if they want to make.
Am I audible now? Are you able to hear me? Okay. Yeah, I will just make two very quick points. Since Dr. Thomas Isaac is sitting here, I wanted to raise these 2 points. The first point is about the Disaster Management Act, which came into being in 2005. You will find under this act, you have a central authority, state level management authority, district level authority, and there is nothing said about the Gram Panchayat or the Panchayat Raj institutions. They are all clubs, local authority, and the intention appears to be that if there is a disaster, it will be the higher level governments which will manage, which will tell what should be done, and the Gram Panchayats are only expected to carry it out. In my view, as has been done in the case of Orissa, can we give the authority to the local governments themselves? Let them decide when to have a lockdown, when to remove that, and what needs to be done. Can we not give this kind of an authority either at the Gram Panchayat level or at the block Panchayat level? This is my first point. The second point I want to mention is about the reverse migration, which Rajshekhar just now mentioned. It is true that 77% people want to go back. But do we ask the question, why do they want to go back? If they are able to better employed in the village itself, will they go back? Now, the honest fact is we have not been able to provide them attractive employment in the village level or nearby so that they can stay in the village and go. Do we have the data regarding how many number of people are available in the village? What is the raw material availability? Can we not make use of this MSME as a method through which the reverse migration does not take place? I'm talking from the village to the town. No, we need to have a plan for engaging the people within their nearby area. Thereby, they need not have to migrate and get into problems like what we faced during the last 2 months. That's it. Thank you very much.
Thank you, sir. Dr. Palnidurai.
Chairperson, may I interrupt you? There are a few questions. I may read it out for you so that the panelists could take it up while they respond. If they make the final remark.
Okay, please.
May I go ahead? My question to all eminent panelists is that the current situation we are facing against time and the way a few of democratically strong states have managed to deal with COVID-19 pandemic. What is the message for states having not so deep-rooted or deteriorated decentralized governance so that they can quickly manage to deal with the situation arising due to pandemic and lockdown? Of course, I think it's better that they let it wait till tomorrow to get a proper answer. I hope the panelists will have something to add. Devolution is the answer to the core question. Hence, it is important that all the states must review, the necessary mechanism shall be developed so that PRI can function as institutions of local government in letter and spirit. One of my colleagues has a question to you, Dr. Reddy, is that have you initiated? There are more questions coming. Dr. Amling would like to ask you, have you initiated any study from NIRD to explore the resource crunch of local government during COVID-19 pandemic? Another young colleague, Shensi Matthew, would like to know, the presentations are excellent, was also insightful. Panchayats in the southern states have been addressing the need at hand. What all local governments can do to mitigate the post-pandemic crisis? Yeah, I think people started thinking about post-pandemic crisis. That's very good. Okay, over to you, Dr. Reddy.
Thank you. I'll try to respond and then I'll request my other panelists to add on. Now, let me say that the southern states have performed extremely well compared to other states, and obviously southern states have deeper PRI setup. And of course, Kerala is on the top, and expecting other states to follow Kerala may not be possible. Kerala is, of course, an ideal thing to learn the lessons and then improve it upon, because Kerala has completely different decentralization history. It will take a lot of time for other states to reach that. But the next issue is, as I mentioned earlier, whatever the things that are, yes, Joseph? No, I cannot hear you. I cannot hear you. I'm not able to hear you. Yes.
You are not audible. That's what I'm saying. Could you please speak perhaps? Are you able to hear me? Are you able to hear me? Hello? Dr. Reddy,
Can you
you
hear
are
me
not
now?
audible. That's what we are saying.
I switched off my video. Am I audible now?
Yeah, you are better now. Yeah, that's
Can you
it.
hear me?
Yeah, you are
Can
better.
you hear me now?
Much better.
Okay.
We are hearing you. Please go ahead.
Yeah. So what I was mentioning is, emulating Kerala will take long time. And of course, learning lessons from Kerala is, of course, the important thing the other states should do. And southern states have performed fairly well. I must congratulate the leadership of the southern states for this. But as I was mentioning, waiting for the devolution to happen, and then in terms of resources and other aspects to happen, instead of waiting for that, can in fact the state leadership or the activists, the friends of Panchayat Raj institutions, local governments, can we have a mechanism to nudge the local government's leadership to move towards responsible leadership, as Dr. Palnidurai has mentioned? And of course, this juncture, relook at the plans which have been made for the 2021. Relook the GPDP plans that have been made and incorporate in managing the COVID situation or post-COVID situation. In fact, we are not in a position to say when the post-COVID situation date is starting. It is a continuous process. We have to keep moving forward and learn. So there's nothing like a post-COVID situation. It may be 1 year or it may be 2 years, but we have to ready. So we have to reset our plans, development plans for the COVID situation, and accordingly move forward. And we have to focus on certain issues like protecting the senior citizen, children, women, and mainly going by the principle of respecting and suspecting. Respect, no stigma to be attached. We have to respect. But at the same time, we have to suspect that anybody can be a carrier. And accordingly, we have to follow the precautions, the measures which have been prescribed, like social distance, wearing the mask, hand washing, and so on and so forth. So suspect and respect will go together in this case. And of course, proactive anticipation and planning is required. And I think the state leadership should groom the local government leadership to proactively plan. As I was seeing yesterday in TV, in I think one of the panchayats of Karnataka, permission was given to celebrate one festival where the social distancing norm has gone to wind. So I think it has to be anticipated and then plan accordingly. Then the next question is, how can we strengthen the local governments? And of course, more devolution and more responsibility to be given to them, and state governments have to devolve funds and so on and so forth. That process is going on. And it has taken 20 years and to reach this stage. Is there any other way of approaching and supporting the local governments and strengthening the local governments so that they can move forward? I think Dr. Palnidurai has made a point that bottom up, moving from the bottom, feeling that empowerment among them, how can we create it? Of course, the capacity building and conscientizing the leadership. So how can we create such institution? I think in the introductory inaugural session, Mr. Manishankar Iyer has mentioned the panchayat body which has met and then discussed. They have gone to disuse. Can we think of a non-governmental, but of course, involving the local bodies? Can we have some strong setup which can become a platform to pose the issues, problems of the local governments and start discussing? Suppose, for example, the 15th Finance Commission. Before the 15th Finance Commission, everybody made the presentations what they want. But is there any body from the local governments, especially the Gram Panchayats, who represented and presented before the 15th Finance Commission what exactly the Gram Panchayat want, what should happen? There is no such body. Of course, the state government has made, the department has made, and so on and so forth, but it was never from the hearts and souls of the leadership, local leadership. So can we think of a parallel body, non-governmental body, to support these local governments and thus strengthen the local governments? Maybe I'm thinking in the lines of, let us say, IT sector, NASCOM supports them. Can we have some national level, regional level, such setup to support the local governments, especially the Gram Panchayats? So regarding the study, what Dr. Ramlingam has asked, we are working on different areas of research. Of course, we are focused on the capacity building through, of course, the IT using the technology. We'll be moving on to those research aspects also. So with this, I'll leave it to the panelists and of course, Dr. Thomas Isaac to respond to the queries.
I will take from one of the points now Dr. Reddy has raised. What can we do to empower the local governments? He specifically mentioned about 15th Finance Commission. I think that is a very important entry point. Now, I have very little hope in trying to pressurize the state governments to devolve more to the local governments and so on. These are long-term projects. But what could perhaps be done is, 15th Finance Commission is not going to complete its report by October or anything. Things are so uncertain. How can you make any calculation for the future? And therefore, something that can follow out from the present webinar is, and we put together a document what has been the response of the local governments to the pandemic. From what I've heard, I don't know if it's a fair sample, but from what has been heard, there have been exemplary performance among the local governments. And it's also very clear. And when it comes to what has to be done, it has to be done at the local level here, whether it be the relief work or say monitoring the spread or say now any kind of exit plan with reference to say agriculture and so on. Now local government has got to play a very central role. That's very, very clear. And therefore, it should be possible to put together a very elaborate, serious memorandum to the 15th Finance Commission, not from any particular state government, but supported by everyone who have been working in democratic decentralization, committed to it, drawing out this experience and emphasizing the need for much higher devolution to local governments. Perhaps making it, say, kind of incentivizing the state governments to devolve more. That's perfectly legitimate. So I think this is something that can concretely come. I do not think we can avoid say, addressing the local government empowerment in this fight against COVID. So I don't want to put large agenda and so on. Okay, we can have a lot of things, but something focused upon 15th Finance Commission. And now we have a report. Perhaps do away with the tide funds altogether. Leave it to the local governments to decide the priority. In fact, that's something they should do immediately. Why tie up the limited fund into basic grant and sanitation and so micromanage it? So I think this is something that can come out. We can all work together, bring together experiences, show the potential, and then go to the Finance Commission that the allocation for local governments must be substantially increased. I think I feel the first most important breakthrough has to be in devolving the funds. If you have the funds, then functions anyway. There is no activity mapping or anything. It's a big thing where state, center, everybody can work. That functional division is all concurrent. And therefore, once the fund is there, well, you have the money, therefore you choose your function. I think that is the way it was done in Kerala, and that would happen in the rest of India. So this is what we had in mind, some concrete actions to come out of the dialogue here.
Thank you. So I would like to thank all the panelists for their valuable suggestions, and I think the organizers would compile and go on. And thank you, Kila, Gift, and Dr. Thomas Isaac for this opportunity. Thank you very much.
Thank you, Dr. Reddy and the panelists for this very insightful session. Now we shall move on to next session, which is going to be chaired by Dr. SM Vijayanand. The speakers are going to be Srimati Aruna Roy, Dr. K. Ravi and Dr. Yamini Iyer. In another few minutes time, we can resume.
Yamini ma'am will join in a while. All other panelists have joined.
What about Dr. Ravi?
Yes, sir, ma'am.
You are not. Video, Dr. Ravi, please.
Start.
Hello. Yeah, I think Dr. Ravi, would you like to switch on your video?
Yes, it is on now.
It's on, but you are visible.
Oh, sorry. Just 1 second, please. Yeah, John. No. Am I okay?
You need not be visible, even otherwise.
How about now, Joseph?
Not yet.
Maybe the connectivity is poor. You can continue the audio.
I'm clicking it.
No, clicking might get more problem. I think your voice is enough. Both.
Can you hear me now?
We are hearing you. That's better.
Okay, then fine.
Okay, thank you very much. We welcome the panelists. We have Sri SM Vijayanand. You know that he has been, he has been the secretary at the Rural Development Ministry, and now he is the former chief secretary, and also currently is the state Finance Commission, chairing the session. We have none other than Srimati Aruna Roy, with us, and Ravi Raman and Dr. Yamini Iyer. Okay, over to you, Sri S.M. Vijayanand. Thank you, and welcome all of you once again.
Thank you for giving me this opportunity. Welcome to my fellow panelists, especially Aruna ma'am, Ravi Raman, Yamini. I'm a little hesitant and nervous speaking when Aruna ma'am is going to speak next. But before that, let me say that I'm quite sad while speaking about MGNREGS. The whole thing, if anything can give some trigger to the rural economy, it is MGNREGS. It just mentioned in passing by Government of India in the Finance Minister's announcement. Not even 1 rupee has been added. No assurance that MGNREGA will be there. There seems to be some visceral prejudice, and that makes one sad. So, if MGNREGA has huge natural advantages if it is used as per the spirit of the Act. It is as per demand. It is as per need. It is for rural areas. It is for the poor areas. It brings cash flow to the worker, and it stimulates the local economy. It is doable. It was done several times. Somehow it has missed. And MGNREGS can be used for livelihoods, agriculture, animal husbandry, fisheries. It can be used for natural resource management. It can be used for poor infrastructure. And all this are not just giving cash. It is also building the economy, particularly capital investment, or I would call it, in the conventional sense, some investment for agriculture. And MGNREGS is for all, the poorest to the poor, elderly, differently able, even mentally ill. There are different ways of redesigning, which is provided in the law for designing MGNREGA for different sections of people, women, everything, so-called work study. And now the homecoming labor, they are all to be employed probably to require another doubling of the current. But there are a lot of issues which I want to highlight. One is, over the years, it has become allocation based, which is against the letter of the law, let alone the spirit. Second, we have very funny notions about job cards, dormant job cards, Aadhaar, IT linkages, bank account. All these have added confusion of various sorts, but all of them can be sorted out. The huge arrears of wages, which never happened in the earlier days. I was there in Delhi for 3 years doing MGNREGA, but now it has become arrears, huge arrears. And then another big problem, because there then also so-called centralization of data. All this data goes up, and at the panchayat level, at the people's level, nobody really understands what is happening. At the micro level, there is no proactive capturing of demand. It's a routine kind of thing, mostly decided by the BDOs. The Gram Panchayats by law are there. They are called the principal planning authorities in the rules, but they don't exist. They have a very, very vague role. And no participatory planning. They don't discuss which asset which person wants, how it will not clash with the agriculture season. These are all simple local things which we have missed. And of course, weak human resources for the support system, even though every panchayat has a Gram Roskar Sevak and a technical assistant. And over the years, the accountability system, Aruna ma'am will testify to that, has been weakening across the country, including Kerala. And a lot of excluded labor, people who are in the villages who have lost work because there is no agriculture there, and the new homecoming labor, they are economically displaced. So all these people, now we have to restart the whole thing. How do we start? The first thing is there should be some, even a weak assurance from Government of India. All states down the line, they respond to signals, even if signals are not very strong. And in 2014, I was doing MGNREGA. Most states clamped down on words, thinking that the new government is going to stop MGNREGA. There was not even a word. But this kind of thing is there. So rationing will not be there. It's one assurance, at least for this year. I'm not saying forever. The Government of India says there is not going to be rationing, and symbolically double the allocation. This is not a big deal. It will start. And on our part, let's get it started. Let's not wait for all these things to happen, and we can change on the go. That is the advice I would give. When this government took over in 2014, He launched an initiative called Inclusive Participatory Planning Exercise. So politically, it should be acceptable even now. So you are using the IPPE, where you're going to the people and bringing them together, and the labor budget needs to be revised now. Labor budgets were prepared in December, after which the whole situation has changed. Total revision is required because it doesn't hold good. And Jharkhand at one point of time, thanks to the involvement of people like Arna Ma'am and Nikhil, prepared something called Kam Mango Abhiyan. People go and ask for a job that is linked to the plan. That is which is not. When we started NREGA, there were hardly any SHG in India except Andhra Pradesh and Kerala. Now, India has 60 lakh SHGs. 60 lakh SHGs, probably having about 6 crore women. These women demand, plan, coordinate execution, do concurrent social audit, and link their plan with livelihoods. And out of the 60 lakh women in SHGs, not 60 lakh, 60 lakh SHGs, large number, I would say about 50 lakh, are quite good. Then, the post-NREGA situation, the 14th Finance Commission has given 2 lakh crore, had given. And 15th Finance Commission has calculated will be, I don't know what will be the economy next year, but if it goes by the current trend, will be 4 lakh crore for the panchayats. So there's a lot of untied fund lying around, which means at the local level, you can do a lot of coordination, much more integrated planning. The labor organization, organize the labor, because they need to be organized for different purpose, and reviving the cluster facilitation system, where civil society organizations were allowed. One important thing, one of the rare positives of this crisis is a lot of civil society organizations are back helping the people on their own all over India. I did talk to about 300 or 400 of them in different webinars, and they are doing very useful work. And if they could be used, they are willing. When I talk to them for reviving NREGA, you have a CFT. That part is very important. Then, Government of India itself, again, this government, initially they called it Light, now they call it Unnati, which means those NREGA workers, the children of NREGA workers, can be skilled and given a job. Skilling in 3 months, 6 months, 9 months, they can do. And they have a target of about 2 lakhs or something in 2-3 years. But it's not, I don't think it has happened very well anywhere, including in Kerala. So that element also needs to be revived. And one of the rare things in NREGA, all the schemes since independence, is that it is the most research scheme. Research not by any simple grants, by very, very credible people and organizations. That has again fallen flat. We need to revive so that how it is helping. We need online kind of response from the people. Then the big question, I don't want to answer, I leave it to Arna Ma'am. How to diversify NREGA. Some people are saying, let us do farming under NREGA. One of the, because I was part of the discussions at that stage, when farming means the worker was got a modicum of freedom, can go back to the farms, back to the landlord, and there could be huge moral hazard. So any kind of diversification will not affect the gains so far, economic, social gains, and it will not be, it will give additional work, not substituting existing work. And it will be the autonomous decision of the worker, and it should be boosting the livelihoods of the worker and not get locked up, and should avoid moral hazards. I know, ma'am, when we discussed, I think more than 10 years ago, in introducing certain services, if possible, in NREGA. I remember the late Gopalakrishnan leading the discussion from PMO. That is care services, care of the palliative, those who need palliative care of the elderly. So on a very normative basis, if that could be brought in. So a lot of this care and compassion activities, mentally challenged children. So, and those kind of things could be linked to NREGA. And I personally feel, even if it is sent a message that the so-called health sub-centers, which are now renamed as wellness centers, could be one of the items of expenditure under NREGA. Madam, let me conclude. I will not take much time. One, to regain is a chance of regaining the importance of NREGA. After a very long time, I see emotional language used, even by economists and not ex, and not leftist people alone, all other people on the sufferings of the poor. I have not heard it since the early 70s. So it's coming back. That opportunity, even hardcore media, they're saying something should be done. So we should use that opportunity to regain the importance, reclaim the space of the civil society as a support and advisory system, and build on the small but organic public action which has now happened in the COVID situation. Real public action, scattered, diffuse, may not even build up to a movement. And so that kind of thing is something we should look at. With this introduction, may I request Anna ma'am to make the comments. Not audible.
Srimati Aruna Roy, you please, you are muted your audio.
No.
It's okay.
No, we're not able to hear you.
ഷീജ എൻ്റെ വീഡിയോ വരുന്നില്ലല്ലോ എൻ്റെ
Ravi Raman's video is not there. You're audible.
The problem is if Ravi Raman's audio and video comes, it will be both will be bleak. Actually, in your case also, Chairman's case also, right, audio was not very good. So Sri SM, can we call Dr. Yamini Iyer or Ravi Raman? Ravi Raman, hello. Ravi Raman, could you please start? I suppose.
Yes. Yeah.
I start. In between, we'll sort out the other issues. Yeah. Please.
Yeah. Thanks, Chairman, and Vijayanand sir, and you have made a very good introduction. That helps me to situate the way in which I really wanted to approach this whole world of NREGA. I would say that of course we all know that it's a big legal entitlement, perhaps the only employment guarantee scheme that we have in India. My point first is that we need to have a new approach to NREGA, in the sense that first of all, there is no point in seeing this as I think we shouldn't confine ourselves to.
Your voice is still not coming. They're trying. They're trying. We have asked Ravi Raman to speak.
Hello.
Continue, Dr. Ravi Raman.
Yeah, please continue.
Yeah, so it should not simply be considered as an employment guarantee scheme alone. It's not just like that. It is something beyond that. It is a social protection scheme. So we need to be very clear about it. So first of all, when I say that we need to change our approach to NREGA, I mean two things. One is this, that look, instead of seeing this as just an employment guarantee scheme, we go beyond that and see this as a social protection scheme. That is point number one. Point number two is that, as part of changing our approach to NREGA, point number two is that, no risk, whether it is flood or coronavirus or drought, anything of that sort, is class non-neutral. It has its own class implications, caste implications, So it is not gender non-neutral. Yeah. So the thing is that, we need to have a very different kind of understanding about the differential impacts of this particular risk, that is coronavirus risk, on different communities. This is the second point I thought that as a beginning I would introduce. So first we change the premise from employment guarantee scheme to social protection sort of a thing. Secondly, we say that this is gender non-neutral, or class caste non-neutral, because it has differential impacts. And if we go to the actual statistics, we find that whole lot of what is called intra-state differences that one could find in terms of the performance of this NREGA. I mean, some states like Chhattisgarh or some other states perform well, whereas some other states are lagging behind. Of course, Kerala, of course, has been performing well. That is what I personally find from the statistics that I have. I mean, then one may obviously ask, how would you measure the success of this particular scheme? Normally, we measure the success in terms of the number of person days generated as far as the poor people are concerned. So based on that, we say that it has been a successful scheme. But at the same time, we ask a whole lot of other questions, particularly with respect to the wages, for instance. And we find that the wage rate is rather low when compared to the open market wage rates. For instance, in Kerala, we know that it is 291, whereas the open market wage rate for agriculture workers is as high as 600. So we know that there is a big wage gap in the labor market. And it is at that time, actually, we are devaluing labor. We are devaluing labor who are involved in NREGA. That's my third premise, in fact. So instead of devaluing labor, we should find a policy measure to revalue our labor. That's the third point that I thought of saying. Then immediately I have just worked out the loss of person days, or rather employment and wages lost under the NREGA scheme during April and May. I had just worked it out, and I found that the all India figure comes about, in terms of person days lost, it comes about 3,500 lakh days of employment, and the total wages lost is about 7,000 crores for the last 2 months. So what does it mean? It means that you need to go for a compensation package, and this compensation package should be either in terms of what is called giving extra days of employment in the subsequent months, or giving the wages lost. That is, they should be compensated in terms of the wages lost. What I mean to say is that because of two reasons. One is that unlike the other states in India, in Kerala you find that more than 90% of the workers are women workers, and majority of them are from the depressed castes. That is, there is over-representation of Dalits in the NREGA workforce. So what I mean to say is that since it is a moral economy crisis, it is not just an economy crisis. This coronavirus crisis is not just an economy crisis, it's a moral economy crisis. Specifically because it's a moral economy crisis, we need to bring in the moral elements in order to find a proper concrete solution for this. As part of bringing concrete solution, I would develop these two suggestions. One is either you compensate the days lost in subsequent months, or you compensate in terms of the wages lost. And we need to be very specific that it shouldn't be in the form of what is called unemployment allowance, because that's again far less than the what is called the wages that you are giving to NREGA workers.
Yeah, so the mute and unmute is not.
Yeah, which itself is much lower than the open market.
It's showing mute.
Yeah. So what is that okay? I mean, am I audible? I mean, it's almost over. I thought you have been hearing me. Hello? Hello? Audible. You're audible.
Audible.
Yeah.
Yeah.
So the thing is quite clear that, look, I mean, we need to go for concrete solutions, and for which I would make a suggestion that you need to have a conceptual understanding of what's going on. I mean, without having a conceptual framework, then we would continue to say that, okay, they should be paid more, or they should be given more days of employment and like that. No, that's not enough. That's what I'm trying to say. We need to place this in a very different conceptual framework. And that conceptual framework is what is called a moral economy framework. Why moral economy framework? Because here is a very particular situation where you find that there is an overrepresentation of the Dalits working in this particular non-accumulating domain. It's a very non-accumulating domain. I mean, you don't save anything, out of working in this Narega sort of activities. Never, ever. They don't save at all. So this is a non-accumulating domain where you find the overrepresentation of Dalits and Adivasis. And that is specifically why that you need to bring in the moral elements whenever you want to resolve the economic crisis. So at the moment, we should request the central government to announce a moral economy package in such a way that either the number of days lost should be compensated, or their wages lost should be compensated. I would obviously prefer the second one. Second one would be the most preferred, because it is specifically in that context that we would be highlighting what is called the job rights for the Narega workers. Thank you so much.
Now, ma'am, can you hear us? Unmute.
Yes, done.
I'm glad. Can you hear me, Vijay?
Yes, very clearly.
And thank you so much. And sorry for all these glitches. I am in rural Rajasthan, so you must forgive me all the failures of the mic and so on, and maybe many other things that will fail besides. So, want to begin with greeting all my fellow panelists. It's so nice to see you all in these times of isolation and all kinds of distance that have been imposed on us. Congratulations to the government of Kerala and Dr. Thomas Isaac for again being a first in organizing one of the first discussions by a government with the people on the possible alternatives and alternative ways in which we can look at a whole set of issues. I want to begin with a response to both the speakers before me by saying that we live in very unpredictable times. But one clear prediction that's been a possibility in front of us in the last 14 years or so of Narega is that processes always work. Whether and principles have validity even today. Though we may not be able to predict exactly what will happen, the fact that there's been such an influx of migrants back to the villages, and in a sense where we run these very small NREGA unions, in some villages where there were only women, they've now got men and boys, and it's doubled and trebled in size. So that shows a kind of need-based, that NREGA MGNREGA actually meets the basic needs of that community, and employment is a very, very critical need. All groups, we've been, of course, having so many discussions and so many discussion groups in the last 47, 48 days around MGNREGA and COVID. And all the groups working with MGNREGA agree that the present structure of the 100 days will have to be strengthened and sustained. And it should not be tampered with, because it's given us a legal frame within which we can really claim at least those 100 days. In fact, it should be made universal. And this universality, and it should be self-targeted as it has always been. But a new framework is required which must go beyond the structure to not only have open-ended employment, but to enjoy all the MGNREGA entitlements. You know, this act, as was mentioned earlier, has a significance far beyond its economic value. It's also been one of the biggest moral victories for the working class. We have never had any act passed which we wanted till this act was passed. It has really been a phenomenal victory of the self-defined needs of people. So despite the fact that we'll want the universal self-targeted and income supporting programs to survive, how do we envisage it will affect us post-COVID? If we diversify to allow labor to be made available and expand the idea of how it can be used, it will, for one, empower the panchayat to diversify in many ways. How will it allow the panchayat to diversify? As Mr. Vijayanand mentioned in the beginning, we will have ability to have more services, not only caring for the elderly and the sick, and also doing the kind of checking post. I don't know how long this COVID virus is going to threaten our lives, but to take care of all the multiple ways in which we need to take care of ourselves. It will even enable distributing food for disbursement, cooking, and the third one would be health services. And I think these would be impacted by an enlarged NREGA. The second thing that I'd like to talk about, productive activities for self-employment. We've had a very important and a very sharply focused range of activities, but now we can expand those activities. And when we look at rural development and development of other alternatives, including sectoral development of what is largely called industry, I would say that we should also look at kitchen gardens, homestead land, farmland, production of their own farmland, in their own kitchen garden, in their homestead land, and also some things that we have really looked down our noses, which I have most certainly, is the whole question of handicrafts and other cottage-based industries, which have really been pushed into the hinterland of our consciousness for a very, very long time. The third one, which Jayati and Prabhat and Harshmandar had also suggested, is wage subsidy on enterprises, which yesterday Dr. Isaac also suggested, which Vijay has also been speaking about. But I think, how will you look at this wage subsidy on enterprises? One great fear, and I would really say I agree with the previous speaker, that in one sense, the moral victory of the individual worker has really been strongly suspect and become a part of the issue on which greatest ire has been expressed by people who are big farmers, small industries, people who have exploited labor. So the power of the worker's decision and to go where he or she may want, she or he may want, and to get into a particular kind of industry must stay with them. So that's why I think what we need to do is to talk about that the decision to go wherever, to work in whichever industry, should remain with the worker, and the choice of enterprise must remain with the worker. And that's therefore the wage subsidy must go to the worker and not to the industry. So if it goes to the industry, they'll end up being bonded labor. And in that case, we'll vitiate so many of our dreams, beginning with the idea of employment and ending with the idea of freedom, freeing people from bonded labor, which has been, for most people on this panel, a great and important exercise of our lives. So I would really say that I agree also with Dr. Raman in this case, that the moral victory that we have gained through the NREGA will somehow has to be sustained by providing for all the possible ways in which we could be derailed. One thing about migration and the migratory, we cannot stop migration. So no matter what we say, people are going to come from Bihar to Kerala or go from wherever to wherever. So Kerala, I think, would be a very, very wonderful place to begin an experiment on how individual job cards could be used in any part of the country. Why should it only be used where they are? Can it be used as a part of the workforce's empowerment in terms of migration to various places? Can it be used in another state? It's something we'll have to look at. Then there is the whole issue of urban employment guarantee. I don't know in Kerala, your village and your city are cheek to jowl. But in many cases, it's not so. The urban area is very clearly defined. So if you can get your local bodies to look at urban employment guarantee, there are many drafts floating around. If we can look at these urban employment guarantees, which we have been demanding vociferously by many organizations of which I'm a part, are asking for it. Again, Kerala could be the first to look at an urban employment guarantee program. State government gives a guarantee for a part of the remaining work days. For instance, 100 days are now guaranteed. 150 days, the government of India can stretch. What about the other days? So we think if they can raise resources through small taxes, dedicated sources, and for cesses, for instance, surcharge on fuel, we go by the example of the Maharashtra Rural Employment Guarantee Scheme, which really raised and which still has funds in its Maharashtra Employment Guarantee Scheme, still has a huge fund which is raised through all these small taxes, some little bit on the fuel surcharge transferred itself onto a bus ticket. So little things added up to a great amount of money. In Kerala knows how to deal with the imaginative and creative taxation. So I think we have to look at these possibilities of how to fund this. I don't think we should over depend on government of India, because with the way they are now, with a PM Cares fund in secrecy, where there is no transparency of that fund, where there is federalism has been so badly hit, where states which are functioning resources, I think in some way we'll have to look at raising local resources. And we also have to look at some things like the New Deal. And that's where another alternative and the expansion of MGNREGA comes, because with Roosevelt's New Deal, he not only brought in massive employment programs to address depression, but he also allowed people to do whatever they could. So they painted and they crafted and they did all kinds of things. I went to the University of Illinois once to talk, and I found the whole university, half the university was built during New Deal. Walls were painted at that time by artists. So why can't we think innovatively and creatively? And again, I think no better opportunity than Kerala, where there's a history where walking through Trivandrum, I saw your entire wall of one of the walls of a very major building painted by the artists of Thiruvananthapuram. So where that kind of spirit of sharing art, which is not a collector's item, but it is a work of the people with the people, I think, and you bring in an entirely new concept. And ultimately, I think the people's plan, which has been the basis of Kerala's participatory approach, going back so many years, of which Dr. Isaac and Vijay, Arvind, and many others in this room, whom I can't see, were part of, I think we go back to the notion of a participatory process. And that process, I promise you, will always work. And since Kerala started another participatory process today, and in inviting us to offer our comments and our suggestions, you have really opened up again to getting voices of the people. One major, big hole for me is that this COVID has put us into these isolated rooms where we lock ourselves up and we can't really meet anybody. And the basis of the NREGA, I mean, for me, was walking through hundreds and hundreds and hundreds of villages, talking to workers and peasants and asking, what do you want? And everyone said, we want employment. And that's how it consolidated into an MGNREGA, and it became their idea, their concept, and their law. But how are we going to talk to the migrants? How are we going to find out what exactly is their priority list? And finally, how are we going to impact and demand public health? How are we going to impact and demand that there is a state commitment to welfare? How are we going to think of a new welfare program, a welfare state? And in that, MGNREGA plays an extremely important role as social security and also as an employment guarantee. Thank you so much, and thanks for bearing up with the glitches of my connections. Thank you.
Thank you, ma'am. Just one clarification. Kerala has been running an urban employment guarantee scheme, exactly a replica of NREGA in its urban areas. Not too big, but it has been running for nearly 10 years now. Okay. Now,
we would like to see what it looks like. Please do share it with us.
Sure. The guidelines are the same, but it's not so intense, except in rural kind of municipalities. I may request Yamini to leave her comments.
Thank you. Thank you very much, Mr. Vijayanand, and to GIFT and to the Kerala government for inviting me to be part of this very, very important deliberation, and to have the opportunity to listen and learn from so many people since the morning. I thought I'd, as Mr. Vijayanand, as you were speaking, I was reminded of a conversation I had with Nikhil, actually, probably at least least a decade ago, when he I don't know, when he sort of mentioned as we were talking at that time, I think it was about the right to information, that after 5 or 6 years of closely engaging with the implementation of NREGA, that he actually fears for the political life of the right to information more than he fears for the political life of NREGA, because it has so deeply seeped into the everyday lives of rural India in a way that no politician will ever be able to reverse it, although they will do everything in their capacity to try and undermine it. And reversing the gains of the right to information is more vulnerable than the gains of NREGA. And as you were talking, I was reminded of that conversation because in the last 5 or 6 years, a lot has been done to try and undermine and reverse the gains of NREGA, repeatedly so. Same time, every crisis, every moment reminds us that in fact, MGNREGA is the lifeline of the Indian welfare state and is the lifeline of the lives and livelihoods, which the phrase that has now become so popularized in our public discourse. But it is actually NREGA that is the lifeline for these lives and livelihoods, and that is the backbone to which we always return in moments of crisis. So I think even though the power structure always seeks to find ways of undermining what potential NREGA has, the people always fight back. And that gives me a lot of hope for what NREGA means to India, and most importantly, what it means for the architecture of of the foundations of what a welfare state is. The other element of NREGA that has really been brought home to me very, very starkly in these last 48 days of the lockdown, in ways that I always understood theoretically, but not enough, but not enough from empirically or from understanding what it truly means to individuals, is what NREGA is defined in terms of what it means for dignity and rights of workers. And what we have seen unfold in these last 40 days as workers, as India has been stripped of its right to work, and workers of India have been stripped of their dignity. What this really brings home is how critical the narrative of dignity and rights is to how we frame our citizen-state relationships and how we frame the foundations of our welfare. And there is very little in how we talk about welfare when we talk about it as an income transfer or a universal basic income, which has now become the flavor of the day, that can actually ever make up for the fundamental core of what the articulation of NREGA, which is an institutionalized form of ensuring that rights of workers are protected and that the dignity of labor is protected. So I think that to me, these are the two most important things that give me some hope for what the post-COVID future is going to be, because I feel these 48 days have been a very important reminder of how deeply rooted a program like NREGA is in the everyday lives of rural India, how central it is to our welfare architecture and to preserving the lives and livelihoods of people, but also most importantly, that it gives us a grammar through which we can talk about rights and dignity of workers in ways that we lack if we didn't have this framework. The challenge, of course, is how do we build on this? I think the experiences of the last 48 days, especially the horrific injustices that have been unleashed on India's workers, I'm quite convinced today that a lot of people who are walking back home are not just migrant workers, but they are families, people who've been stripped of their incomes and their jobs and are now facing uncertainty, who are going back home to reclaim their dignity and their lives. So I think that the challenge that India is facing is not just about migrant workers or a class of workers, it is about workers as a whole. and that as we look forward, we should be looking at workers across all its subsets and building a rights discourse in a much more robust way than I think the public discourse thus far has, as we classify workers, as I too have done in my own writing, as migrant workers and others. It's workers who are confronting chaos and uncertainty, and this requires us to think much harder about how to reshape labor capital relations as we go forward. And again, NREGA gives us the foundations through which we can begin to have a conversation about what institutionalizing the rights of workers actually means. And I think that's the grammar, that's the language in which we need to build this discourse going forward. One of the issues I did want to highlight it sort of relates to this larger question of the relationship between local governments and NREGA. And I think it's always been a slightly fraught one, not so much in states like Kerala, but even though in its conceptualization, NREGA was really going to be about strengthening the role of panchayats in ensuring in protecting the right to work of its of citizens. In actual practice, this has been one of the most ignored and emphasized aspects of the implementation of MGNREGS to its own detriment, I feel, in the sense that, you know, if you look back to the early days, the law itself very clearly talked about the shelf of works, etc., the participatory plan, all of which was to be built, all of which was to start at the panchayat level and then move up through the administrative system. 50% of works were to be implemented through the panchayat. But in actual fact, you know, the emphasis on building the capacity and capability and the robustness of panchayats to be able to perform these functions, I think always played a secondary role. And over the years, as we began to ask questions about how do we expand the shelf of works, how do we draw on NREGA to think about it as a scheme that can contribute to the larger to other elements of the broader elements rather of the rural economy, the phrase convergence became very, very popular within administration. And while that convergence may have led to potentially a more efficient implementation of NREGA, I think what convergence did ultimately is to significantly undermine the role of local governments, particularly at the panchayat level, to actually draw on what NREGA had to offer in terms of its ability to strengthen participatory planning and ensure and actually linking back to what Aruna ma'am was saying, giving workers choice of where and how and what they would want to work on and work with. So I think that this is a very important opportunity. One of the positive things that COVID has done across many state governments is that it has reminded state governments that you can't fight a disease like COVID, which is so localized, and its impacts and what the consequences it unleashes on the social and economic lives of people is also so localized, without strengthening and bringing in local governments into the strategies for how one needs to address the challenge. And in fact, the nature of the challenge is such that it is pushing governments to think much more in terms of integrated planning. And I think the question that we need to ask ourselves is what needs to be done? What kind of parallel movement needs to be put in place to strengthen the capacities and capabilities of panchayats to be actively participants in the process of designing and implementing NREGA in ways that make more sense for the context in which the program, for their own particular context. And that means initiating a very robust set of debates within panchayats about the nature of the rural economy, about the nature of the lives of people, many of whom are coming back into the rural economy, and how best to leverage the opportunities that this may create, and for NREGA to be drawn as a very important source through which this can be leveraged. Of course, this comes with many challenges because mobility is constrained, and the ability of the system to sort of initiate new campaigns and new plans are going to be limited as everybody is racing to deal with the immediate challenges of COVID. But I think this is an opportunity, and an opportunity that must not be lost, and it's a fight that should be very much part of the fight for dignity and rights that this COVID, the lack of laid bare for all of us. And I think here Kerala has a very, very crucial role to play as a leader, or a sort of leadership role to play in enabling other state governments to move fast. And it also means, I think, a lot more engagement with the Finance Commission. One of the speakers before me had mentioned the Finance Commission grants for panchayats, one of the for rural local governments as well as urban local bodies. One of the challenges with that, as we have experienced while we were studying the flow of funds for the 14th Finance Commission, was that, in fact, the participatory plans, while very critical in terms of what they sought to achieve, also serve to become a bottleneck in the movement of money. And the performance grants for the 14th Finance Commission slowed down in many states that weren't able to put together weren't able to deliver the participatory plans in ways that Ministry of Panchayati Raj and Ministry of Finance had conceptualized. Or at any rate, it was used as an excuse. Drawing on Finance Commission funds in ways that don't build these bottlenecks, but at the same time can use these funds to really strengthen the participatory planning process at the panchayat level. That's a challenge that I think has not been resolved in many parts of the country over several decades of trying to strengthen local governance. But it's one that confronts us at a very critical time, and one that I think we should put our collective thinking and work towards, because this is an opportunity. This is, I think, a rare opportunity in what has been a drought of opportunities to regain the conversation about the strength of local governance and how critical local governments can be in protecting the dignity and rights of Indian citizens. So I'll stop there.
Response to some of the points made. One, Professor Ravi Raman said it's a social security scheme. But in Delhi, we've always been arguing it's an economic development scheme for the poor. The social security is seen as something secondary. And there was one finance minister, not of the NDA government, who said it's just dole. NREGA is a dole and should not be continued. So it's not social security, it's economic development with all the associated things which are related to moral economy, which Yamini has said. Second, MGNREGS is actually a bundle of rights, not just right to live, right to equal wages, decent work. I can go on and on, but that we see. Then something which I recall, Mr. Jairam Ramesh always used to say, NREGS has triple objectives: strengthening the right to work, creation of permanent assets, and third is strengthening panchayats. So he said this is triple objective or a trilemma. It's something which refers to what Yamini was saying. The last point I want to say was, I've been trying to think, not to articulate. It's time that the local governance of Kerala shifts from a welfare state mode to a caring state, which is more individualized, more outreaching, and more merged. So just a philosophical thought. Now let us go to questions. If Professor Joseph has some questions received by now.
We have a few comments. I think one comment is with respect to Kudumbasri. I think perhaps we can postpone it for Mr. Raju or Raju. I think Mr. Raju, this issue about Kudumbasri better raise tomorrow because we have a special session on Kudumbasri. Ramit Basu has a comment saying that MGNREGA should be looked at beyond wages, which has been the chief rhetoric all these years. The key objective of the scheme was to rejuvenate the lost, I suppose, to rejuvenate the lost environmental balance and stop forced migration. Comment 2. Villagers returning from the cities to villages can be fruitfully employed in rejuvenating the lost biological diversity, create employment, biodiversity-based livelihood opportunities through MGNREGA. In PESA areas, the Gram Sabha can plan to preserve and propagate the natural resource in a way that can lead to overall environmental improvement as well as livelihood. We need to find a way to marry the provisions of the PESA Act of 1996, BD Act of 2002, FR Act and MGNREGA Act, which are all for environmental protection and livelihood promotion, so that a convergence emerges, whatever. We need the making a remark. Job rights for the MGNREGA workers, employment guarantee, social protection, very valid points. Okay, I think I will stop here. Thank you very much. These are the kind of, I think, concern with the environment along with.
Comment that, ultimately now there is more and more thinking, even in the context of COVID, that environment needs to be built back, nurtured back for local livelihoods. So I think it's very valid. And another interesting suggestion, linking PESA, which gives powers to the Gram Sabha, MGNREGA, which gives work and from the Gram Sabha, and FRA, which means a lot of livelihood opportunities. And it can be linked and you can work in the forest in common lands. It's a very good idea. It needs to be operational. Now I'll come to Arna ma'am for your concluding comments.
I think, I can't say how interesting it has been to hear Dr. Raman and Yamini, of course, who's an old friend, and we have shared many a protest and many a walk together and many a social audit together. And I understand that it's not easy. And with MGNREGA, people have had an immense faith in the program, as she said, and they've also had the only established relationship with the government where they had dignity and where they had some semblance of equality. In all other relationships, they were always at the receiving end. So I think what the MGNREGA has done in terms, Dr. Raman, in terms of social dignity and welfare has been enormous. I agree with you. But what has been always against us is the petty bureaucracy and the establishment, which has wanted to destroy us. But no matter what, again, I go back to Yamini and I go back to all the other things that we've always believed in, that actually they have not been able to destroy us. With all the political ill will, it has not been destroyed. With all and in fact, in many places, all political parties claim that they gave the MGNREGA at the time of elections. So it was to actually win an election. So I really think we need to ensure that this structure delivers again for us. And that's a challenge, I accept, but it's not impossible. And I think I go away with this, what I take away now is a great deal of positivism that we can make it work. There will be diversities in terms of ways we approach it. And I think some of the issues I raised, which I hope Kerala deals with in its planning, will help all the states happening in their states and help us lobby with our governments so that we can get such things happening elsewhere. So thank you very much for this opportunity. And I don't want to take too much time because I think I must let the others also wind up. And I hope we'll continue this conversation beyond this TV screen.
Thank you. Can I come to Professor Ravi Raman?
Yes, please. Thank you so much for a wonderful discussion. This idea of linking what is called the PESA and the Forest Rights Act with the NREGA and sort of things are excellent. But the point is that, if we continue to retain this labor with within the what is called the low wage sector, then what exactly would be the future of those communities? I think that's a point that we need to think about when we really want to socially transform the communities. I mean, if we continue to confine them to the what is called the low wage segments, then I think the future wouldn't be that bright. So the point is that, we need to know that in what way the economy is being disembedded from the society and in what way that these people are continuously being devalued in their everyday activities. So that is something which is to be reversed, and that could be reversed only and only if we have a completely different framework, completely different conceptual and ideological framework. And that's why that I thought that we need to go for a very different intersectional sort of an approach. Without having an intersectional approach, or without bringing this intersectionality, we wouldn't be able to understand the fact that these people are subjected to multiple layers of both oppression and exploitation. That's the point. It's not just a question of keeping low wage segments alone. Apart from that, they are being oppressed through various means. So it is the particular way in which that they are subjected to multiple layers of oppression and exploitation that we need to find a solution. And that solution, as part of the larger social transformation, should be in the form of what I would say by going for a completely different moral economy framework.
Thank you. Yamini, any concluding remarks?
Just one sort of point, I think, in response to what Mr. Raman said, that I think, one of the realities of NREGA that I don't know that it gets it's as well understood, is actually the impact that it had on the labor market, especially where it has been implemented well, and that's on wages, and that's one of the reasons why local elites actually have a complicated relationship with NREGA. So I don't think that NREGA is about how it's commonly understood as keeping people digging holes. It's very much it's actually much more complex than that, and in its framing, because it is framed in the language of rights and dignity, it empowers labor in ways to strengthen its bargaining position vis-a-vis capital in ways that I think very few other traditional social safety nets can, and it is for that reason that its integrity must and needs to be preserved. But of course, this is also an opportunity for us to draw on everything that we have learned of what works and what doesn't work in the complex labyrinth of implementation, and where strengths and limitations of the existing state capacity and implementation architecture are. And I'm hopeful that at some point, when we are able to exit from our spaces of isolation, we will be in a position to have a revived and robust conversation of what we learned from at least the 10 very robust years of implementing NREGA across the country, and how we can draw on those learnings to strengthen what NREGA has to offer, and in light of very new changes and social transformations that have taken place over these last 15 years since the law was first passed. Just one last point that Mr. Vijayanand had brought up, and I forgot to mention in my initial remarks. I think one of the most exciting things about NREGA, especially in the first 5 years of its implementation, is the kind of community it built up, the community of activists, the community of researchers and academics, the community of bureaucrats, of politicians and others, who were all actively engaged in understanding, critiquing, evaluating, studying, and participating in the discourse on it. I don't think there has been a welfare program, at least in the 20 years that I've been actively engaged in public policy, that has attracted this kind of multi-stakeholder scrutiny, if you will. And I think that scrutiny only made us richer. It was a reminder of how important it is for different aspects of society to come together to better understand critical elements of policy. and how effectively it can contribute. And of course, there were many moments of tension, and no government likes to hear critique, and any kind of dissent always found ways of being curbed. But benign neglect on the part of government allowed for this community to rise and to flourish. And I think that the last 10 years of this community not being as active has only been to our disadvantage. And perhaps this too could be an opportunity for rebuilding a similar multi-stakeholder community that actively engages in debate and dialogue, not just on NREGA, but on many of the larger fault lines that COVID has exposed in our state and in our society, for us to debate, dissent, critique, agree and disagree for a better future.
So thank you. Very fascinating discussion to be expected from such a panel, eminent panel. An odd combination of one bureaucrat and three activists. So excellent thing. The two
Mr. Vijayan is a bureaucrat activist that we have learned from.
So to tell Professor Raghuraman, the reality in most of the backward parts of India, NREGA wages are higher than the real market wages in agriculture in most parts of India. At least that was the situation 3 years ago. Then second, a slight disagreement with Yamini. You said it is benign neglect by government. I worked for 10 years in NREGA. It was always active encouragement from government, which got all the studies, all the meetings, discussions. Anyway, thank you. Thanks a lot. Thank you. Thanks for the panelists. Thank you. Over to Gift. Over to Gift.
I hope I'm audible. I think the panelists are still around. Thank you, the chairperson and the panelists, for such an enlightening discussion on an issue of much pertinence today. Thank you once again. I don't think that the discussion could have been better. Thank you. And we are now moving towards another related issue, which is financing local government during the pandemic, wherein we'll start it after 5 minutes break. 5 minutes break while we set the connection with the new panelist. Okay, thank you once again. You can perhaps take a break.
വീഡിയോ ഓൺ ചെയ്യാനുള്ള ബട്ടൺ ഇപ്പൊ വന്നു. അയ്യ അതൊന്നും ആവണില്ലല്ലോ. ഒരു മിനിറ്റ്
കേൾക്കുന്നുണ്ട് സർ, കേൾക്കുന്നുണ്ട്. ഓഡിയോ വീഡിയോ ക്ലിയർ ആണ്.
Everything is clear.
Everything is clear. Pinaki sir?
Yes.
Yeah, okay sir. Okay sir, thank you. Raghunandan sir? Hope you can hear us.
Hello.
Okay sir.
Can you see me?
We cannot see you, but we can hear you. Your audio is clear.
Okay, sure. I'll start my video a minute later.
Rahina ma'am, can you hear?
Yes, I can hear. Can you hear me?
Yeah. Audio is good. Okay.
കാണാം അല്ല കാണാൻ.
Let me not have my video because of the slow internet connectivity. So it takes, more bandwidth, and then you cannot really hear me. So that's why I'll speak. Yeah.
Okay, sir. Please continue with your audio.
Pinaki. Hello,
So
Pinaki. We are going to recommend a special tower nearby your home. Okay, or special tower for you.
that's not possible today.
For the last 1 month, we have been trying that.
Yeah. So I'll just speak. Let's not have the audio. Let's not have the video.
Your voice is very good. No problem. That's good. Yeah.
Okay.
That's better. I think we have all the panelists, but we have to keep to the deadline because we mean time. 5. We'll start. Our chairman is on the way. Shahina, how are you?
Good, sir.
Good. You are from Trichy or Trivandrum?
I'm in Thrissur now.
I see. I thought
I came here before the lockdown.
UK. She's visiting Gila. Oh, I see. Okay. Professor Chathukulam, are you from Kottayam or from Bangalore? Are you from Bangalore? Hi.
I'm in Kottayam.
You are in Kottayam, sir.
Kottayam.
Right. That's nice. I hope you're having nice rain, I suppose, here, isn't it? It didn't rain? Okay. So, all are Raghunandanji is from? Where is he logging from? Bangalore. Okay. This is the only panel that has promptly came on time 15 minutes earlier, I think. Sir,
Dr. Joseph. Hey.
Hello, hi.
Yeah, that's it. Hi. This is Joseph. Raghunandan Saab. Nice meeting you.
Hello.
That is the precisely why I sent the car for you. To chain you without chains. 10 minutes each. Include 10 minutes for this convention of the day. That should be followed strictly. 10 minutes each. Minutes will be, anybody needs less than 10 minutes? Hello. The norm of the day was maximum 10 minutes. And if anybody wants to speak less, please inform us. No more than 10 minutes will be given anyway. Nobody's opening. Nobody's responding.
I'm okay with 5 minutes.
No, that cannot be that brief. No, can be brief, very brief, not too brief like that. We're waiting for these are the okay. Our chairman is coming. Once the chairman comes,
അത് ഇടയ്ക്ക് നോക്കി പോലെ എനിക്ക് കുഴപ്പമില്ല ഇതുപോലെയൊക്കെ കിട്ടുമായിരുന്നു
program. Copy തന്നെ. And all the logistics. I will give you the mic now right away. The program. I will copy the program. Okay. Okay, friends, we have the last session of the day, and in fact, the most important session of the day because that deals with the finance. Without finance, nothing is possible. You are aware. Your MNREG and all is not possible without money. Okay, now we are going to deal with the financing local self-governments, which session is going to be chaired by Professor M. A. Uman. No introduction needed, neither for the chair nor for any of the speakers here. And we have the norm which has been very religiously followed the whole day. None will be speaking more than 10 minutes. So we have got, including the chair, we have got so 10 minutes each, so that 6 o'clock, 7 o'clock we can wind up the session. And thank you very much for agreeing to join us at the fag end of the day. And also we welcome you on behalf of Pila and Gift. Okay, Professor Umar Saab, you are going to take over.
Okay.
You are the
Thank you
chairperson.
very much. Good evening to everybody.
Good evening.
Evening, sir.
I think we had a hectic day today. From the morning till this last session. One thing that has come out most prominently is that local governments are no longer poor relatives, but eminently part of federal polity and have an important role to play in the development, particularly in the context of the corona virus situation. No doubt about the fact that more than any other tier of government, it is the local governments that have the information, the capability to monitor, the capability to decentralize the responses and enforcement. Without going into further aspects of it, let me start with in a wider canvas. We find that there are at least 4 important challenges as a result of the COVID-19 episode. The economic challenge, the health challenges, welfare livelihood challenges, and most of all, part of today's discussion, financing challenges. All the tiers are equally part of these challenges, and the role, responsibility of each tier consists with the domain of their responsibilities. Suggestions, very few, tell you that all what I say are part of certain assumptions or presuppositions that we have to bear in mind. The 73rd, 74th constitutional amendment unlike the federal fiscal federalism notion, the developmental concept of the citizen is acknowledged rather than citizen taken as a consumer or customer. Secondly, health is a social good. United States of America, more than any other state in the world, is demonstrated how the health sector, the market has failed in that country and in saving the life of the people, protecting people. And this is a major factor, which I mean that health is primarily a social good which should be controlled socially and delivered mostly with public intervention. Then we have to acknowledge the fact that by and large the decentralization, even after 26 years of its life, has been halting and leaves many things to be desired, particularly in the context of fiscal decentralization, is important in the present context. The whole question of financing, if you analyze it in a wider perspective, we have to see it in short-term solutions as long-term, as part of long-term plan. Now, my solution, the suggestions, very brief indeed, that I am going to make are given under three captions. One, at the local government level. Two, for the attention of the 15th Finance Commission, which is deliberating these issues at the moment, I suppose. Thirdly, the MB-LADS program vis-a-vis COVID-19.
Uman sir is not audible. Please check his mic.
Based on clear, solid studies that the urban local governments could produce or contribute about 44% of the total revenue of municipalities, as against only 5% by the rural local government. This is a deplorable situation. Even the contribution of 44% by the ULBs is not something to write home about. We know that of the, and this is on the basis of the Economic Survey 1718, out of the total urban income, only 3% is taxed even by the urban local government, as against 0.1% by the rural local government. Compare the situation. There is tremendous scope in this country, which is claiming to be the fifth economic power of the world, highly urbanized or fast urbanizing, we have tremendous potential both at the rural as well as at the urban local government level. I suggest that property tax is undertaxed in India, both at the urban level as well as at the rural level. Property tax contributes only 0.14% of the total GDP of the country. And in 2002, 3, till 2017-18 and certainly afterwards, what was 0.18% of GDP in 2002, it has declined to 0.14% today. This is not something that shows lower productivity and under taxation of the property in the country. We know, and that too on the strength of economic survey, that states which have devolved considerably and made significant progress, like Kerala and Karnataka, have only tapped 33% of their potential in regard to property tax. Several houses, luxury houses in Kerala, are remaining untaxed. In a, I, the way I started, let me briefly say that the second point is that land monetization, betterment levy, another possibility I have to elaborate at top. Then a borrowing proposition is suggested, that is corona containment bond can be issued by all municipalities who require that at a coupon rate much below the market rate but above that of the reverse repo rate for 10 years, and that can be an opportunity which suburban panchayats also can try to take up. I have several suggestions that have to be made before the 15th Finance Commission. For want of time, I stop that and request Pinaki Chakravarti respond.
Finance and taxation for this opportunity. Am I audible?
Yes.
Yes. Thank you. Yes. As mentioned by Professor Roman, capability of decentralized response is enormous, and local governments certainly can play a very effective role in containing COVID. The response in the context of COVID, as we have been discussing, have to be protection of life, providing livelihood and containment of the spread of virus. In each of these, local governments have a major role to play, and financing is critical for that. So local government finances, if we look at, are characterized by very low level of fiscal autonomy, characterized by very low level of revenue and low level of expenditure. In the overall expenditure of center states and the local governments with their agency function spend around 6% of the total combined government expenditure. Barring Kerala and a few other states, untied fund at the local level is almost non-existent. As we all know, local governments are mainly performing agency functions, implementing various central and state schemes in most states. We have seen the kind of positive role fiscal autonomy and empowered local government can play as a responder to pandemic in the context of Kerala, and also providing social protections to the migrant laborers. It is true that overnight, the fiscal autonomy of local government cannot be increased. But with the 73rd and 74th Amendment, an enabling framework has been created and it exists, and it should be strengthened by the states. But in the context of pandemic, what can a local government do and how we can empower their finances, that will be the focus of my presentation, a very brief presentation. Before I get into the specifics, I just wanted to mention that a recent study by NIPAP, I was involved in that study. We have reviewed this SFC report of 25 states, and it revealed that the average time taken by SFCs to submit its report is around 32 months, resulting in an average delay of about 16 months in submission of the report. Moreover, states also appear not to have acted promptly on the recommendation of SFCs by not placing in 8 years before the state legislature in a timely manner. And that delay, if we take into consideration, I think State Finance Commission as an institution in most states have really not been able to play its function post 73rd and 74th amendments. So in the context of pandemic, then from the financing point of view, what should be done is a question. I don't think there is any specific answer to that, but a couple of thoughts I will highlight before this August audience. Now, as we know, in most states, SFCs, the panchayats and the urban local bodies are doing agencies function. Overnight, this cannot be changed, and strengthening some of the agency functions could be done. The most important one in this context I would highlight is MGNREGA. As it was mentioned by Aruna Roy in the last session, 100 days should be strengthened and sustained. A quick analysis I have done shows that MGNREGA percentage generated is only 48% vis-a-vis its potential during the last year. And also, if we look at the absolute allocation in nominal term, it hasn't shown much of an increase in the last 5-6 years. It needs to be increased with more allocation and by creating demand with all the norms of social distance in place. And local bodies can play a very effective role in providing livelihood through NREGA post-pandemic. As we know, the incidence of COVID-19 is mostly concentrated in urban areas at the moment, but with reverse migration to villages due to the lockdown, the role of local self-government will increase when it comes to quarantine, providing social protection and livelihood security. Adequate fiscal space to the local bodies should be provided for. This is about claiming that space for local government in the context of COVID for life and livelihood. If not done, there is a possibility that we will not be able to contain the virus as effectively as we have done so far. Grants from the Union Finance Commission, if we look at, there has been a lot of discussion on that. Now, I'll just highlight what 15th Finance Commission has done. The 15th Finance Commission has awarded around 90,000 crore as grants to the local governments and an additional 4,400 crores to metropolitan areas for improving air quality, particularly in winter. The overall grant to the local bodies, if we look at, has increased by 8% when compared with 2019-20. So in other words, if we talk about inflation, the increase of 5%, so there is an increase of real increase of around 3% as per the recommendation of the 15th Finance Commission. The Commission has allocated 50% of the funds for local governments other than million plus urban agglomerations as timed funds for sanitation and maintenance of open defecation status and supply of drinking water, rainwater harvesting and water recycling. So in a way, these are all tied grants. And the practice of tied funds creates serious problem of integrating the Finance Commission grants to the local planning process in states like Kerala, where every local government continue to prepare comprehensive annual plans. So there is a serious question here in the context of COVID response. Can these grants be used or can be realigned so that the local government can become the first responder on some of the issues that we have discussed? But looks like most of these funds are tied. So can we really at the state level request the Finance Commission to actually provide a COVID response grants in the change context of COVID? Since panchayats are in the directive principles of state policy, states in general should consider local government as an institution that should be strengthened, empowered to fight COVID. Introduction of the Urban Employment Guarantee Program in the context of pandemic can actually help relieve some of the burdens and distress we have seen to the when it comes to migration and people leaving cities. I think the last point that I would highlight, I think local governments, given their limited fiscal autonomy and also limited roles that they generally have played in various states, except a couple of states including Kerala, I think local governments are also doing innovative work sectorally in many states. And there could be some exchange of ideas among the states to learn from each other in this change context so that they become the first responder of this pandemic. Thank you very much.
Thank you for keeping the time. And in fact, only 63 crores of rupees have been additionally given by the 15th Finance Commission's interim report for local, rural local governments. And we may endorse the point that the basic grants can be raised to 100% without any tied grants in the context of COVID. Let me call upon Raghunandan.
Thank you. Thank you, Professor. It's good to be at this seminar and meet all my old fellow travelers on this decentralization journey. All the usual suspects of the decentralization mafia are there. I must say that they are a very obstinate and tenacious lot. Most of us have been on this task of strengthening local governments for the past 2 decades, and if not more. And actually, the situation has slipped rather than improved in these last 2 decades, particularly on the fiscal side. Let me also say that Kerala has made us all very proud as Indians. As a Malayali, I am particularly proud of how Kerala has handled this crisis. And as the Guardian said, your health minister is a rock star. And if I may say so, the entire cabinet is actually a rock band. But let us not rest on our laurels. This is only the beginning. And we have serious financial problems going forward. Now, one of the things that I kept hearing today was, I mean, it's a very condescending thing about building capacity, building. I mean, 20 years back, we heard about building capacity. Now people are still talking about building capacity. Let me just put this capacity in the context of COVID a little bit in perspective before we go to the financial points. As of today, there are 4.6 million cases cumulatively. The US has 1.5 million cases, increasing by 25,000 every day. Spain has 2.74 lakh, increasing by 1,500.
Russia is hot on the heels of Spain. It has 2.62 lakh cases, increasing by 10,000 plus. UK has 2.36 lakh, increasing by 4,000. You know, in 1 week more, number one will be US, number two is Russia, and number three is going to be the UK. And it's ironical that these three were the allies of the Second World War, and they can't handle this, right? They were the successful winners of the Second World War, and they're not going to be able to handle COVID. They haven't done it so far. So what capacity building are we talking about? Nobody has a clue how to handle this. In fact, in that context, I think Kerala is a world leader. Like many other small towns and cities and some countries like New Zealand, we are a world leader. So we should be giving capacity building classes to others. And our panchayat should be training others, not the reverse. Monetary stimulus package. If you look at what the government of India has announced, it says 20 lakh crore will be given, right? Now the entire budget of the government of India is 27 lakh crore. So obviously this money is not going to come in the form of money, because certainly the government is not going to divert 74% of its budget to fund fund the COVID response. So what is the government doing? What the government can do? Four things. It can give real money, like enhancing NREGA, enhancing pensions, enhancing the finance commission grants, etc. Or it can increase its own expenditure, like what Roosevelt did, and improved government expenditure during the depression, so as to give direct employment to people. Or the government can forego money. It can give tax rebates, or it can give interest concessions, waiver of loans, etc. Now the problem with giving tax rebates and interest loan concessions, etc., is that it reduces your tax base even further, which means it reduces the amount of money that you can use to create new programs. So it's going to be a Hobson's choice. I am sure Professor Thomas Isaac is himself feeling it, and I am sure, in all fairness, the Union Finance Minister is also feeling it. So, and we must also remember that the economy was tanking even before the COVID virus hit us. So we were already getting into a kind of a recessionary situation, and the COVID virus has just accelerated that downward spiral. So let me make it very bluntly clear. In my opinion, I don't think we are going to get much more money. The real stimulus in terms of financial packages coming down to the panchayats is going to be very small. At best, we can do a few things like probably increase the flagship program NREGS allocation. But you must remember that even in NREGA, there's been a huge backlog of wage payments still remaining to be paid. And of course, what Dr. Pinaki Chakravarti said about realigning the Finance Commission grants, that's also something that I think is reasonably it can be done. It's all been tied down, not like the 14th Finance Commission. But I'm sure the Finance Commission, since it's given an interim report, will be able to untie this and probably make it more flexible, more COVID oriented, etc. Now, if you look at the states, let me come to Kerala. We've done a study in Karnataka from Accountability Initiative, and the study in Kerala is just being completed. So let me give you a sneak preview of what Kerala is facing at the moment. Kerala is a fiscally stressed state. Kerala says that it is giving money to the panchayats, and I must say that it is actually keeping up with that allocation. Though there was a time in the 4th Finance Commission's report period when the allocations actually, as a terms of percentage of the allocation of the state, of the SOTR of the state's own tax revenue, had declined. But if you, the state is still managing to give maintenance funds of 5.5% of the SOTR, general purpose grant of 3.52%, and the development grant of about 25%, though the Finance Commission of the State Finance Commission had actually progressively recommended an increase from 22% to 30% in the 5th year. The state has not been able to manage it, but it has still managed to retain that allocation. However, there are some very disturbing things about Kerala, and I'm not blaming Kerala. Please, I mean, in this kind of time, I would never blame Kerala. I am just saying that these are things that a state that is fiscally strapped has to resort to in order to ensure that the panchayats get the money. One of the first things that Kerala has been doing is that it has been subsuming the Union Finance Commission grants into the state funds, and it had also taken a World Bank loan, and it has used that money to substitute its own allocations to the panchayat. So actually the panchayat's allocation from the state is progressively decreasing as a proportion. So the state is trying to substitute its own devolution with funds coming from the union government and from the World Bank. And now there's a second implication, a second point that we have noticed, which is somewhat disturbing. If you look at the planning guidelines of the government of Kerala, which has been issuing for every plan period from 1996 onwards, you will see that the guidelines have become over a period of time very elaborate. Though initially it was very simple, and it said that there were only some upward limits and some minimum allocations and a negative list that was prepared, and the panchayats were free to actually spend within those limitations. All the plan guidelines have become progressively tighter and tighter, except the last planning guideline, which has become somewhat loose. But then what happens is, and that is a very interesting thing which Kerala doesn't talk about. Kerala government has been issuing circulars directing the panchayats over and above the plan guidelines to contribute LG spending towards state-sponsored schemes or centrally sponsored schemes. So what happens is that LGs have to fall back on central and state-sponsored schemes where they can park their money at the end of the financial year if their expenditures are not up to the mark during the year. So what happens is government directives throughout the year necessitating LG contribution for several government schemes is actually further constraining the LG allocations. Is that the constraints on development fund planning have not disappeared. What has happened to the constraints on development planning at the panchayats is that they have moved out from the planning guidelines, which are issued once in 5 years, and they are contained in the annual financial guidelines circulated to LGs. And so therefore, the LG contribution to CSS and SSS is increasing dramatically, and therefore the panchayats in Kerala are actually quite fiscally constrained. And I don't know what kind of decentralized planning are they doing today. And I'm sure that everybody in Kerala knows about it, but nobody wants to talk about it because Kerala would still like to preserve its reputation as a state that is doing well in decentralization, which it is because other states are doing much worse. Other states have constrained the panchayats, as Dr. Chakravarti says. There is hardly any untied fund given to any other state, to panchayats in any other state. So Kerala, even though because of its fiscal stress has been narrowing the panchayat expenditure space, is still comparatively much better than other states. Now, my prediction is that what is happening in Kerala today is going to happen at the union government level. As the union government begins to suffer from fiscal stress, panchayats are going to be left to their own devices in order to improve their finances. I was a consultant with the 14th Finance Commission through Accountability Initiative, and we did some work. We realized that 60% on an average across all states of the Gram Panchayat expenditures were being funded directly by the central government. So what has happened is that the state government began to withdraw its money, and the union government was substituting its money, bypassing this, well, not bypassing physically in a sense, but edging out the state finance package with its own money at the panchayat level. So paradoxically, we have a situation by which the third tier and the bottommost level of the third tier, the Gram Panchayat, is actually by and large funded by the union government. Now, if the union government is not going to be able to raise taxes because the economy is tanking, we must think about other moves. Now, one thing is Professor Uman spoke about two or three very important things. I too very strongly believe that property tax is a big potential tax which the panchayats have not been raising. It's politically very easy for a panchayat to not raise property tax, to not take the unpopular political decision of raising property taxes if it is able to substitute that with money that comes from above. I mean, no government, no politician wins elections by saying that they will increase the taxes. Then there is therefore no hard budget constraint for a panchayat to function as an agency. So we do need to increase the property tax. I mean, a small study that we did in Bangalore, I would estimate that in Bangalore city, without raising property tax rates, by just mopping up property tax, by enhancing the tax base and properly documenting all the houses, we should be able to increase the tax in Bangalore by 3 times. And that's a conservative estimate. So property tax is a very good tax. I don't know whether we can impose something like a piggyback tax. Can Government of India include on the income tax an option for a state government to raise a 2% or a 1% piggyback tax, so that whatever income tax that is raised in a particular state at the option of the state can be increased by 2%, and that money comes into a fund which goes to the local governments. And maybe that fund can come into the local government with certain incentives based on how much of property tax they raise. So a piggyback tax based on how well you collect your property tax with a separate funding to the local government might be able to improve. But I also suggest that there are some very important things that should force us now to go in for greater efficiencies. If we cannot get government money, and if government money is tanking because the economy is tanking and therefore taxes are tanking, then the existing money should be able to work harder. The government rupee must travel further. Now, there are three ways in which we could be able to do it. First is we must clamp down on corruption. Experience shows that wherever the economy has collapsed, eventually people's intolerance of corruption has increased. You see, a growing economy is very tolerant of corruption. In the United States, between 1865 and 1930,
Time
it was one of
is
the most corrupt countries in the world. Yeah, I just finished very quickly. We must be able to control corruption and ensure that that money goes to the panchayats in a more efficient way. Second thing is our institutions. We have multiple levels, multiple institutions, complicated workflows, complicated fiscal transfer system, parallel bodies. We need to reduce all these workflows, give all the institutions to the panchayat to handle, dismantle parallel structures because they are all rent seekers and impediments in actually delivery at the ground level. And my last point is that we must be able to improve the decentralized procurement system. Kerala has come out with a manual for local procurement, which is not the PWD manual. The PWD manual is antiquated. It is built for leakage and corruption, but other states do not have a decentralized procurement manual. So in these three ways, if you are able to improve efficiencies of the government, then the local government can make the rupee travel further. And to my mind, Kerala can show the way, and it must show the way because there are no capacities anywhere to handle this. And you have actually proven that you can do this. Thank you.
Thank you. Let me call upon Jose Chatikulam.
Is it clear? Hello?
Yeah, we can hear you.
Please go ahead. Okay, fine. Thank you. Yeah. Respected Professor M.A. Uman and respected panelists. The general assumption is that the local community can understand the aspirations, the opportunities, and the constraints in a better fashion than any other agency. See, and therefore, the local government, which is closer to the citizens, it needs to be actively engaged in the identification and resolution of disaster management issues, including the COVID-19. This is what my first the assumption, the whole thing. Then the point is that I would like to say that therefore taking this kind of activity, there are two major legal framework for this. One is that there, as we all know, the constitution is very sound. It says the local governments are expected to do the functions of local economic development and the social justice, in addition to the civic amenities, very clear. Then you look into another interesting aspect of the Disaster Management Act of Disaster Management Act of the 2005. I would like to say that there, you see, the disaster management, as per the Disaster Management Act, there are two institutions at the sub-state level. One is that there the district disaster management authority and the local authority. And as far as the district, the disaster management authority, I am very happy in the sense that there are two very powerful sub-state level institutions. One is at the district disaster management authority, and second is the local authority. But I would like to say that there is a reservation in the sense that there, what about the national and state disaster policies? This is a major issue. So the point is that there, when we actually drafted the national policy and the state policy, what happened? The act has been diluted, And as a result, what happened? There was no legitimate space for the local government institutions in tackling the disaster management system. So my first submission is that there very seriously we have to revise the provisions. The thing is that there the national, the policy of the disaster policy, which is operating at the state level and the national level. There's a kind of a conflict between the act and the policy practice there. See, as far as this COVID-19 is concerned, I would like to appreciate the local government, not only in Kerala, almost the entire country. See, look that there without getting any kind of particular order from above, quote and unquote, from the above, or from a kind of a very explicit statutory support for doing that, or the local government by their own, they all jumped into the issues and they could manage the issue at that level. So the point is that there, what the local government are doing and all over the country, we all know that there they are doing 101 things, identifying the cases, giving support to the quarantine, those who are have some kind of a contact with the patients. It may be in the same sense that there the operation of the community kitchens, whatever may be things there. So by seeing all the things, I would like to say that there it is actually reinforcing the hypothesis that local government is the most appropriate political entity to tackle the disaster and very particularly the COVID-19. See, in this case, I would like to say that there, because of the local government, the public leadership has been contextualized and understood as a public good. This is what there, as far as the major contribution is concerned, in the involvement of the panchayat in the COVID-19 management. So the question is that there, then we can talk about the finance aspect. I would like to say that there one aspect, look into the devolution index, which the reports and studies by the Indian Institute of Public Administration and the Institute of Tata Institute of Social Science. You see that what happened? There is a mismatch between the financial devolution and the devolution of the other domains. What my point is that there all the studies shows that there the financial devolution is less than by 10 points in and around. So the point is that there the functions devolution is bigger in size. In some cases, what happened? You have a very good legal framework. And in some cases, what happened? Your functionary is also not that bad. But the point is that there is a serious mismatch between the functional and other aspects of devolution and the financial aspects of devolution. So my point is that their financial aspect of devolution has attained the lowest score value of all these studies. It gives an impression that there, as far as the financial devolution is concerned, it is the lowest devolution among other domain or parameters of the devolution process. Then we look into the sources of financing of the local government. Generally, I would like to say that there are 5 sources. One is that their internal source of the local government, and there are 2 other sources from the state fund and the central fund that is there. As far as the point is that there the central fund is concerned, you take the central finance commissions. What is our experience as far as the 14th finance commission is concerned? See, I can just give a kind of a quotation from the 14th finance commission. 14th finance commission has made that there. Hence, we recommend that no further conditions or directions either by union government or by state government for release of funds to the local government. But there were conditions and directions by different ministries. Look, the Ministry of Finance, Ministry of Local Government, Ministry of Rural Development, and Ministry of Panchayat Raj. They have given that their things there. So finally, what happened? Because of these directions and kind of orders from different places, we have said that there the 14th Finance Commission, if money is there, untied fund. But actually what happened, the fund became tight fund as far as the local government is concerned. I can give you one example from the state of Karnataka. What happened in Karnataka? 25% of the local, 25% of the finance, the grant has come to the Karnataka. That actually at the state level, there was a cut of 25%. Yeah, 25% for charging the electricity to the Panchayat.
Please.
Yeah. Okay.
Your time is up. Please take 1 minute and wind up.
Okay. Then you look into the state finance commissions. State finance commissions. State finance commissions. The point is that they are. You already mentioned that they are how the state finance commission is working in the state. I can give you 2-3 examples. Take the case of Arunachal. Take the case of Arunachal Pradesh. Arunachal Pradesh has rejected the state finance commission report by saying that they are not workable. Take the case of Maharashtra. Second Finance Commission, due to the severe financial constraints caused by drought. Karnataka, the recent Finance Commission, the 4th Finance Commission has submitted the report. And there were 2 major recommendations by the Finance Commission. One is that there, as far as the non-loan net own revenue receipt is concerned, and the grant which is coming from the center, you are not supposed to consider that as a part of this non-loan net own revenue receipt. That is separate. It cannot be considered. That is what the recommendation of the State Finance Commission. In the similar fashion, what happened? Whatever you are getting the support from the, I'll get only 1 minute. Whatever you are getting the support from the, from the compensation of the GST, that actually you have to consider as part of this. These 2 major recommendations are rejected by the government of Karnataka.
Let me call upon Professor D. Narayana to respond.
Respected chair and co-panelists. Am I audible? I wish to begin by redefining the title of the session. I wish to call it Financing Local Governments for Public Health. Part of the reason is that, I'm going to refer to the finance and it's not an interim report. They have submitted the report for 2020 and 21, and they're not going to change it because it's not an interim report. It's the report for this year. So my focus is not on the immediate pandemic, but a larger issue of public health. That's why I title like that. As you know, public health is defined as, I'm quoting from the Webster Dictionary, the art and science dealing with the protection and improvement of community health by organized community effort and including preventive medicine and sanitary and social science. I'm emphasizing organized community effort. Now, if public health is an organized community effort, can we think of it without the pivot of local governments? We obviously cannot. So when we talk of financing local governments in the Indian context, what comes to the top of the mind is Union Finance Commission, which is about to submit its second report. There are 3 reasons for thinking of the Finance Commission. First, central transfers
account for 30 to 60% of the total revenue receipts of the Indian states, depending on their stage of growth. Second, the transfers range from tax assignment, sector-specific grants, local government grants, and disaster management grants. And the third reason is, it's an opportunity for the Commission to leave its mark on certain trends of financing, learning from the coronavirus pandemic. Now, coronavirus pandemic has taught us a few lessons, which I think should be entering the perspective of the Finance Commission in designing the transfers to the local governments. What are the lessons? First, in managing each disaster, the local governments play an important role, especially in public health disasters. But the finances transferred to them is not related to it. This has to change. Second, public health disasters should be an important criterion of devolution of disaster management funds and not just past expenditure, earthquake, cyclone, floods, and droughts. Third, sectoral grants, for instance, health grant, too should take cognizance of the above two dimensions, namely local governments and public health disasters. I need not labor the fact that the relative success of Kerala and Karnataka in managing the coronavirus transmission is attributable to a considerable extent to the strength of their local governments. It's well known. There's a lot written on that. Devolution of functions, funds, and functionaries to the local levels of government over the last 2 decades have built up their strength. While in Kerala, it has been sustained irrespective of the political color of the ruling coalition, Karnataka has seen ups and downs. But Karnataka has been able to draw on the strength of the local governments when a need arises, like we heard in the other sessions today. This is an important lesson which the Finance Commission can bring to bear in its recommendations so that public health gets institutionalized in the local government mandate. Here, it may be worthwhile drawing from history of municipal legislation from Great Britain and elsewhere over 100 years ago. The purpose of Public Health Act of 1875 in Britain was to codify previous measures aimed at combating filthy urban living conditions which caused various health threats, including the spread of many diseases such as cholera and typhus, in the context of industrial revolution, urban crowding, poor housing, and sanitation. Although we have inherited many of these municipal legislations as a colonial legacy, they have not entered the books of the Finance Commission in any systematic way while funding the local governments. Coronavirus pandemic is an opportunity for the Commission to leave its mark. The Commission, in its first report for 2020-21, has continued the tradition of making substantial grants to local governments. In fact, I'm not going to go into the details of it. One particular thing is that the Commission has recognized the need to provide larger finances to urban local bodies, proposing to raise it from 32.5% of the total grants to 40% in the medium term. This is, in my view, in the right direction, signaling that state governments have to allocate more funds to urban local bodies. The COVID pandemic has exposed the severe deficiencies of our urban local governments. For both rural and urban local governments, part of the funds is earmarked for drinking water and sanitation. One needs to move beyond and bring in a comprehensive public health trust and put no conditions on the LG grant. That should not be this 50% conditional, 50 basic. I think it should all be unconditional. Now, turning to the Funds for Disaster Risk Management Authority, the Finance Commission believes in continuity and the funds are devoted almost entirely to natural disasters. Allocation to states is based on past expenditures and index with scores for earthquakes, cyclones, floods, and droughts. Now, disaster means natural disaster for them, and epidemics do not appear anywhere in the Disaster Management Act 2005 or Finance Commission reports. The reality, however, is very different, as I argue below. I do not understand the reasoning behind having criterion such as earthquakes in the allocation formula. A state that had an earthquake this year may not have one next 10 or 20 years or may not have at all. Maharashtra had an earthquake in 1993, but not since then. Many other similar examples can be given. So also with floods. But droughts and cyclones do have their cycles, and some states get more of them. Now look at epidemics. Take the period from 2000. There isn't probably a single year without a report of an epidemic in some part or the other of India. Take, for example, H1N1 or the swine flu. Every year since 2010 has reported H1N1. Total number of cases till 2019 is around 1.6 lakh and fatality over 11,000, with case fatality rate going up to 30% in some states. Over 70% of the cases were reported from Tamil Nadu, Karnataka, Telangana, Maharashtra, Madhya Pradesh, all the states that we are talking about today in the context of, COVID-19. I strongly believe that these need to be considered as public health disasters and be included as a key criterion. If we had learned these lessons earlier, I think COVID-19 could have been handled better by these states. Now, bulk of the funds devolved should be earmarked for the local governments as they play a crucial role in containing the spread of diseases. The village and town health and sanitation committees should never be starved of funds. Mitigation funds, as proposed by the 15th Finance Commission, should also be made available to them. Now let me turn to my third sort of issue, that is turning to the sectoral grants. The Commission, the 15th Finance Commission, in its report, rightly points to the very low level of public expenditure on health and the need for improving public health infrastructure and human resources in health. The Commission then quickly goes on to recommend the establishment of medical colleges in 247 districts, use of public health facilities for private sector institutions for starting specialized diploma courses, use of specialists from the private sector to treat patients in the district hospitals, and so on. The Commission believes that these initiatives will improve services in the wellness centers and fulfill the goals of Ayushman Bharat. The thrust is on public-private partnerships. What else do you expect when the expert committee is filled with the titans of the private sector? I hold a different view on the subject. Now you look at Ayushman Bharat, it had two goals, namely setting up around 1.5 lakh health and wellness centers by 2022 and provide insurance cover to the poor to access hospital care. Now, as far as this hospital care is concerned, its achievements, there are these numbers. I am not going to get into that. These are large numbers, and around in about 1.5 years or less than that, 11,000 crores has already been dispersed to the hospitals. Now look at the record of the health and wellness centers. How many have been set up? 8,000. That is meeting only 5% of the target. Now the emphasis has to change in the direction of public health and disease control. Now the health and wellness centers are aimed at providing comprehensive and quality primary care close to the community. In fact, part of Kerala's success is also because it's much better achievement in health and wellness centers. They are to be equipped, these health and wellness centers are to be equipped to provide treatment for a number of diseases, age-related, occupation. Yeah. They also play a very important role in reaching antenatal care to pregnant women and early care to infants and children, and so on and so forth. Now, because Kerala has been devoting quite a lot of resources for these, that has given us a much better government healthcare sector, which has risen to the occasion. Now, the Finance Commission could be instrumental in getting other states emulate this model by granting funds for this purpose rather than the public-private partnership. Let me just sum up in one sentence. Overall, public health should be the binding force in making grants under the three heads around the pivot of local government. Thank you very much.
Thank you. Let me call upon Dr. Shahina to make.
Good evening, sir. I hope I'm audible.
Yes.
Good evening, sir. I hope I'm audible. Am I audible?
Yes, yes.
Respected chair and fellow panelists and the dignitaries who are watching this program. I would rather concentrate on the local finances related to Kerala economy and the possible impact it would be having on the resources of the local governments and what are some of the possible way out. So before I get on to this, the possible impact on the revenue mobilization by the local governments, the broad contours of the local finances in the last 10 years, I thought I will discuss. So at the time of the submission of the 4th Finance Commission and the 5th Finance Commission, we know that the non-tax revenues had surpassed the tax revenues. But if you look at the recent trends, there had been a decline. If you even at the constant prices, though at the current prices, there had been a tremendous increase in the own revenue mobilization by the local governments. At constant prices, the non-tax revenues has actually declined by almost 2%. The total resources has increased by 2%, but tax revenue has improved. Tax revenue has increased by 4%. Therefore, the composition of own revenue has shifted in favor of tax revenues. Now, what is the reason for the decline in the non-tax revenues so much? Because if you look at the extent of utilization of many of the resources, it has been totally underutilized. For example, the user charges, 692 panchayats are not reporting user charges. Similarly, gate fees, 833. And property from, income from the sale of property, etc. 870 panchayats are not reporting any non-tax revenue. So which means that there is a lot of potential, as Dr. Uman was pointing out, in the own revenue mobilization. There is still a lot of potential even without increasing the rate of these taxes and non-tax revenues. Similarly, as you have pointed out, there is a lot of escaped taxes in the case of both property taxes, profession tax, entertainment, and also the advertisement tax. And to quote the second Finance Commission, they were estimating it to be around 40% in the case of many of the taxes. And similarly, many of the taxes, they have calculated it to be 30%, 33%, etc., which is being carried over continuously in the next few years also. And if you take the entertainment tax, there has been a drastic reduction. Only very few panchayats, 36 or so panchayats, are reporting the entertainment tax of the entertainment tax during the year 2018-19, and advertisement tax only by less than 20 panchayats are reporting the advertisement tax. Now, there is a confusion regarding the entertainment tax, whether it is being subsumed under the GST or not. And based on a government order, I can give you the example of one of the panchayats in Thrissur, that is Tirur Grama Panchayat, which was, for that particular panchayat, the revenue mobilization from the entertainment tax was the highest, more than the property tax. They were mobilizing around 3 crores a year, because thanks to one multiplex complex in Shobha city. And on the basis of a government order, the entertainment tax collection was totally stopped and this particular panchayat was crash-strapped. And later on, based on another order, they have started mobilizing entertainment tax. But as per if you look at the data that is being collected by the Fifth Finance Commission, there are around 60 panchayats which are having entertainment tax more than 10 lakhs. Now at present, the revenue mobilization through the entertainment tax is zero for most of the panchayats, vast majority of the panchayats. Similarly, if you take the advertisement tax, there is still a confusion over the advertisement tax as to how much should be the collection. I mean, what are the procedures for the collection of it? And therefore, only very few panchayats, for example, 19 or 20 panchayats are reporting advertisement tax. Thus, therefore, there is a lot of scope for mobilizing tax and non-tax revenue, the own revenue of the local governments, even without an increase in the tax rates and even the non-tax rates. Therefore, ultimately, what happened was that the own revenue mobilization by the local governments against many of the macroeconomic variables has declined over the years. And another reason may be that most of the finance commissions have been pointing out that there are no revision of the tax rates in any of the years. It's long back that most of these tax rates have been revised, and there is also no adequate staff for the collection of taxes that tax fieldwork has adversely affected. So this being the background, now before this seminar, I was actually trying to find out what is the total expenditure which the local governments are now incurring on combating COVID attack. But most of them are not able to tell us, what is the exact amount, because most of the expenditure has been met through the voluntary contribution. But at the same time, some of the panchayats, we cannot generalize on the basis of a few panchayats for the entire state, but still around 60 lakhs rupees. One panchayat has earmarked 60 lakh rupees for combating COVID cases, because it is not going to end soon, which means that that particular panchayat is having only 1.7 crores from the plan grants. So out of the plan grants, 60%, that almost 35% of the total plan revenue mobilized, plan transfers have been set aside for the COVID cases. So, which means that if 30 to 35% of the plan grants are used for the COVID related activities, roughly around, the plan is going to come down by around more than 2,000 crores this year. And given the financial crunch, there could be decline in the subsequent years in the plan fund. We don't know. And similarly, the non-plan grants may also get reduced. And we know that, the Fifth Finance Commission recommendations were not accepted, because if we are accepting the Fifth Finance Commission report, the plan devolution to the local governments would have increased at the rate of 18%, whereas the corresponding figure for the state plan would have been 10%. So therefore, we could not accept the government could not accept the recommendations of the Fifth Finance Commission, but we are following the Fourth Finance Commission's recommendations in the allocation. And as Mr. Jagunandan has pointed out, we are still, holding over to 25% of the total plan expenditure of the local government is still being devolved to the local governments, despite the financial crunch the state government is facing. But as far as the non-tax, non-plan grants are concerned, it is not the 9%, it is still less than the 9% in the last few years of even the budgeted figures. And so there is, given the economic crisis that the economy is undergoing, there is a possibility that the tax and the non-plan grants and the plan grants can come down. It all depends on the policy of the government. And there is another possibility that, there is, as has been pointed out again by the previous speakers, a substantial amount of the total devolution of the plan grants is coming from the Central Finance Commission's grants and other transfers by the center in the form of centrally sponsored schemes. There is a possibility, though in the current financial year, it may not decline, but in the subsequent years, we don't know what the government is planning to do. And if there is a cut in the Central Finance Commission transfers, definitely there is going to be a decline in the planned transfers to the local governments too. So these are some of the possibilities, but at the same time, we expect that the MGNREGA grants may not be cut because of because it is so deep-rooted in the economy. Now, a few suggestions for overcoming this. As has been pointed out by the chairman, there is a lot of scope for still mobilizing the own tax revenue and non-tax revenues, and as has been pointed out by the present finance commission chairman, it may be around 1,000 crores rupees. In one of his speeches he was saying, so we can mobilize around 1,000 crores of rupees through the mobilization, better mobilization and optimal mobilization of these tax and non-tax revenues of the local governments. Now, another possibility is that in one of the resources, though it has been, the local governments have been given the authority, the least exploited is the borrowings. And if you look at the borrowings is only very small percentage. It constitutes only 1.58 crores in one of the years. And only recently in the last few years, the borrowings have increased because of the LIFE program. So, yeah, sir, I'm concluding.
Note that your time is over.
Yeah. So the possibility is that, the local governments can depend upon the borrowings, and the KLGDF can handhold the local governments in various, in the borrowings and also in PPP, etc. So, and therefore, there is going to be a lot of increase in the expenditure by the local governments in the in welfare expenditure and also direct expenditure, and therefore the prudent expenditure is one factor through which they can control the finances, in the sense that now at present the total expenditure that is going to the productive sector is only 10%. So they are not not exactly following the guidelines which is given to them. So prudent expenditure and prudent mobilization of resources, and whatever is now given to the local governments, if better exploitation or optimum exploitation is done, to a large extent, the finances can be handled in the post-COVID period.
Thank you. Please. Yeah.
Anshuman Carol says that if you look at the plan-wise budget allocation in the last 3 years, the allocation, the GPDP, the Grama Panchayat Development Plan, the allocation from the Disaster Relief Fund is 0. This means that when the GPDP was prepared, panchayats were not aware of the Disaster Management Fund facility. Many Gram Panchayats prepared DRR plans, but even if these are part of GPDP, funds are earmarked from FFC and SFC, State Finance Commission. Directions issued by the Ministry of Finance, Government of India in the year 2014, it was said that 10% of the flexi funds can be used for disaster under centrally sponsored schemes. What happened to these orders? I thought these questions are mostly related to disaster, which we are going to take up tomorrow.
There is another session.
Another session exclusive. I think, Anshuman, thank you for raising these questions. We will take up these issues tomorrow because we are also too late today. And another question is Ramit Basu. It's a cross question to Anshuman. Forget about that. Raju, utilization of raw materials shall be discussed since the availability. Again, this is not, we are a very focused question of financing development. Disaster management, again, question. No, Vinod. I think Vinod Kumar, central government started the discussion of improving the own resource revenue of the local self-government institutions, especially GPs and urban local bodies. Is it a sign of reducing the grant in aid to LSGs? That is the question which is being asked. Jagjeevan, state-specific, community-specific capacity building strategy needed. Yeah, already highlighted here. Kerala can share our learning and experience, but Kerala can't capacitate others. But unfortunately, most of the SIRDs are not capable to capacitate the panchayats. Yeah, this is a remark about SIRDs. Dr. Jose, unfortunately, our disaster management authority is highly decentralized. This is a comment to Dr. Jose. Revenue department is not capable to do disaster mitigation program, no skill, no capacity, and revenue department is one of the outdated department. I think final comment is by Binu Raj. DM Act should be modified and LSGs should get more roles and responsibilities. I don't think that we have it. Yeah.
There is only one
One
question
Exactly.
that is relevant to the context of this webinar subject. That is, are the or do the local governments reduce mobilization of their taxes and revenue in order to attract more devolution from the higher tiers of government? This may be a possibility, but that is not a desirable trend, and most finance commissions, both state as well as central, added tax effort also as one of the criteria of devolution. Even so, the most important aspect, particularly in the context of the coronavirus, is that there is no escape from stepping up, going for more taxation. And as I have said, property tax should be a key factor in that, and the land should be included by simply including land. The yield will be considerably high, and those states like Punjab, Rajasthan, which have dropped property taxes, and also Bihar and Uttar Pradesh, which have virtually no tax at the rural local government level. This is not the way to mobilize resources. And in total, as I have said, out of the rural income of India in 2017-18, only 0.1% is taxed at the rural local government level. This is a pathetic situation that must be addressed, particularly in the context of the coronavirus. I just want to add, so many of my points did not be specified. Now, taking advantage of the presence of Dr. Thomas Isaac, who has been as much an expert and local government and governance. The MP Lads program, which is abolished now for 2 years, not abolished, it should be abolished. Suspended for 2 years, brings about straight 4,000 crores plus non-lapsable accumulated funds over these years appropriated by the union government. At least ostensibly, these resources were meant for local area development, and these should be given to the local governments And the state government should make a plea for that to be done immediately. Thank you. I would like our esteemed finance minister also to take advantage of his presence. Ask him to comment.
Yes, I missed most part of the discussions here. Hello, Pinaki, Shahina, Raghu, Jostatakulam. Now we have put this session for one particular reason. I was thinking this opportune moment to approach the Finance Commission, 15th Finance Commission, not on the basis of some particular state, but by a platform of all people who are committed to decentralization. That Finance Commission, anyway, is not finalizing the report now, cannot. And therefore, we could present a memorandum pointing out the role that local governments can and do play in pandemics like this, a need for a greater allocation to the local governments from the Finance Commission. As of now, for most states in India, the Finance Commission allocation would be, I think, the only revenue that local governments are going to really get. States are in such a dire situation. The axe is going to fall on everything. In Kerala, we have taken a very strong position that departmental plans may be cut, but local government's plan won't be cut. This is partly out of realization the vital, most important role local governments are playing in coordinating all the anti-COVID activities at the local level. In fact, I think they would perhaps even get a greater location than what is given in the budget. Well, that's the intention. But anyway, so perhaps we could all think together how to frame such a memorandum. I think it would have some impact and effect because the deliberations here in the earlier sessions do really point out kind of growing realization of that even in states, for example, where local government experience has not been so very good, they are playing a very important role at the local level in the pandemic times. So this would be an opportune moment to put our heads together, not only to the Finance Commission, but also make the decentralization once more a part of mainstream discussion. I don't want to speak more, but let's see. I think we will continue the conversation otherwise. I think some people, Pinaki can definitely join to draft such a memorandum which can be circulated, and then we take it to the Finance Commission.
Let me take this opportunity to thank all the panelists, all of are my good friends for participating. Carry forward the challenges moment, the challenge of drafting a fresh memorandum to the 15th Finance Commission that is pertinent, relevant, and timely. Thank you.
Thank you. Thank you very much.
How much insight has been brought to the table on the issue. And Dr. Joy and me would like to thank all the panelists and of course, indeed, our dear Professor Uman. And you know that Professor Uman is our honorary professor in GIFT. Woman is our honorary professor in gift, and we thank all of you. Dr. Joy joins me in thanking all of you because it was very enlightening and insightful session. And finally, if you are really serious about taking the agenda forward, kindly put down your thoughts. As yeah, I think.
Say, I have an announcement. I forgot to add it when I spoke last. There were demand from many people that they would like to hear our health minister, Srimati Shailaja. Unfortunately, she has gone to Kanu, and I contacted her. She has agreed to come. Tomorrow, 10 o'clock, she will be speaking. A special address. You're not changing any other agenda, but she would be coming whenever she is available. I think most probably 10 o'clock, and she would be speaking in the webinar.
I was referring to the notes. We will send you this transcript, and you can transform, add your points, and send a decent note to all of us. Thank you very much. Yeah, and again, tomorrow we will be starting at 9:30 sharp, and we'll have also the special address by Honorable Health Minister. Thank you very much. Good night.
അതാണോ ഈ ആര് തരത്തിലുള്ള വലിയ